Hello, world. It's the first episode of No Brainer. Welcome. I'd like to thank you for being part of this momentous occasion. I'm your host. I'm Zach. I'm going to be having fun this evening with my co host, Derek, and our very, very special guest on our very first show, Dr. Gregory Adaka. Did I say it right or did I totally blow it?
You're kidding, right?
You did that on purpose.
I did.
I'm so insulted. I'm going to leave.
You know, I could make a really good British joke right there. But you're so real quick, little background from what we've done research. You're in emergency medicine. You've been a doctor for 20 plus years in Europe and America. And you're coming on our show to give us wisdom on the medical situation in the world.
Well, you missed that one country. I was also a physician in Nigeria.
So that's right, Nigeria. Is that where your family's originally from?
Yep, and that's where I was educated.
But according to your website, you're only a subject matter expert in the U.S. and UK. So, Dr. Craig, I mean, hey, I solved the pronunciation issues from the two. Well, Zach, what are you? Irish, English?
Well, so according to Ancestry, but my last name is Ukrainian.
It's something. But I solved that for us.
I was adopted, so that's why
that explains a lot. But for us, I solved it. We could just call him Dr. Greg. Then we don't have to figure out how to pronounce Adaka, even though it's pronounced Adaka.
Attica. Akadaka. Wasn't that the guy from? Oh no, that was Star Wars. Jar Jar Binks.
I don't know how your I don't know how your audience tolerates you, Zach. I don't know, but well, it takes.
I am the jester, I guess you would say in the podcast world. I'm the clown. Derek's the serious one.
I like it.
Yeah. So let's go into this real quick. You and I met at Podfest 2025 here in Orlando. We met on a fluke, I would say. I got asked to be on Owl's podcast, and you were the interviewer, and I was the interviewee who was upstaged by a little girl. I didn't even know. I should have said no. Just let her go. I'll go next. But we chatted and we hit it off very well. And I asked you to be on the show, and here you are, our first guest in our inaugural episode. So, give us your background. Tell us, born and raised, education, and what made you go into medicine.
Oh wow. That's quite a lot. Okay. Born in Manchester, UK, fiercely proud of my northern heritage because in the UK there's a tendency from those from the south, London and such, to feel somewhat superior to those of us who were born from the north. But darn them, they haven't got any good football teams anyway. Manchester United, Manchester City is one of the best in the world. But I digress. So I left the UK as a child. My parents took me to they're Nigerian, so we moved back to Nigeria when I was only 8 years old. So most of my education and upbringing was not in England; it was in Nigeria, and I was there until I graduated from university as a physician. I practiced medicine in Nigeria for about 4.5 years. And 1 year, the last year, or second to the last year, I did my national service in Nigeria. And during national service, you get sent to a very remote location to serve the most underprivileged as a physician. And I didn't know that before. I was straight out of medical school, and I was the only physician in an entire county in a remote part of the north. It was about 100 miles from the Sahara Desert. I was that far from everywhere else. It was fun. It was rough too. So that was interesting. Came back from that, and the following year, I went back to England as an adult, and where I got my British license and began to practice in the National Health Service there. Did the rest of my formal training in specialization in emergency medicine. In the UK, you don't have what you'd call a residency in America.
Okay.
It's very structured in America. You've got your 3 years or your 5 years, whatnot. Boom, you're done. You're a specialist. In the UK, they drag it out as the British do all things and make life difficult for everyone. It's just an English thing. But eventually got through that, got my specialization in emergency medicine, and I practiced in the UK for nearly 20 years before we finally moved as a family to the US. Having said that, we've been coming and going to the US on vacation with my relatives here, and we always dreamed of coming over here and leaving England behind, which we finally did in 2014. And I've been in America since then. So it's just over 10 years.
Where are you
I'm going to
located?
guess your age.
Where are you
I'm gonna
located?
Guess your age. I want to guess his age.
You're not allowed to guess my age. That's illegal.
I know what it is.
You should know better. You can't ask age during an interview.
I have this whole timeline right here. So I mean,
we'll do a reveal at the end of the program. Right.
So where do you practice medicine now?
Okay, so I'm based in Miami. When I first came to the US, we were actually in New Hampshire. So I was in New Hampshire for 3 years.
Brr.
Oh yeah, shoveling snow, the whole 9 yards,
Yeah.
negative 20 degrees and all that. And then I did what most Brits do. They moved to Florida. The weather's better, reminds me of Nigeria. And it's a big city, Miami, sort of madness I'm used to as well. So the family liked it. We all liked it. We moved down here and been here since. The only major change, a big change that's taken place in my life, I suppose, over the last 2 years, is that I left the formal practice of clinical medicine and became the medical director at the Miami-Dade Corrections. So it's one of the 4th largest jail system in the United States.
Wow.
Yep. The medical services are provided by the county hospital that I used to work for, and I became the medical director of the Miami-Dade County jail system.
wow.
And it's a completely different world from what I've been used to for the last 30 years. But that's a whole other story as well.
So being born in England, then growing up in Nigeria, coming probably, I'm going to guess from a strict family. I have many friends who have immigrated to America, and you know, it's the parents are a lot more stricter than American parents, from what I remember. And although my parents were immigrants, so I dealt with that. But were you driven to be a doctor, or was that something you've always wanted to do? You aspired to become a physician?
The way I say, I sort of like stumbled into it because I've always been a bit of a geek from my childhood. Like they used to call me mad scientist and everything when I was a kid. I had the glasses and I always had my head in a book, and I was always watching documentaries and science things and nature and you name it. Biology was easy for me,
Right.
but I had difficulty focusing, and everything was easy. If you're intelligent, you can you get your A's easy through elementary school. When I got to what you call secondary school, middle school, then I faced the real challenge of you can't just do it by your smarts. You've got to study, and that's where I really struggled. And maths was a difficult one for me. Very easy when I was in elementary school, but my middle school math days were just bad memories. And as I struggled, I realized my dad kept hammering into my head, you can't be an engineer, you can't design anything or build anything if you don't know mathematics. And I thought, you know what? Biology is easy for me, and I like the life sciences too. Yeah, I think I'll be a doctor. I was 14 years old. I think I'll be a doctor. I told my mum and dad about it, and they were like, yeah, our son's going to be a doctor. And I just went along with it. And so I ended up being a physician that way. But I've always had the heart of doing things mechanical, and I still am now. I tinker with cars, I mess with electronics. I've never been able to get away from the more mechanical side of interest in life that I have, and technology and all whatnot. And I think had I been able to focus harder and done good in mathematics, I would have been more of the engineer type. I could have been Elon Musk by now, who knows? But there you go.
You be building rockets and electric cars, huh?
Exactly. Yeah. Now you're talking.
So was your father or mother a physician?
No, my mum was a nurse though.
Okay.
She's retired now. But there was nothing really medical in my family at all. So I was the first and practically the only in my family to pursue the medical field.
Yeah, because most kids at 14-year-olds, want to be a footballer, or a rock star, a movie star, a firefighter, an astronaut. But it's really funny because my youngest, I have 6 children, and my youngest wanted to be a doctor as long as I can remember.
Wow.
And she's in school getting her psychology degree at University of Central Florida, Go Knights. And she watched her cousin go through the MCATs.
Mm-hmm.
And he studied literally 12 to 15 hours a day. And she said, no, I'm not doing it. It's not worth it. I don't care how much they're going to pay me. So she said, I'm going to go the easy route and deal with crazy people. And I said, well, it's perfect, because out of all my kids, you are the craziest. So
you got to know your children, right? You got to know your children.
Yes. So that's interesting. And I admire you, you know, becoming a doctor and growing up. Now, where did you live in Nigeria? Now, I'm going to play ignorant because I don't know Nigeria geographic. I know it's in Africa, so you don't have to give me a hard time.
Good start.
But
Good start.
I don't know geographic. Is it a big is a state, a country? Nigeria is a country.
Yes.
Do they have states in Nigeria like here, or they have provinces? Or okay,
Too many states.
too many. Okay.
No, seriously, because I mean, when I was a kid, there were 12 states, and then sometime in the late 70s, they split them up. And there were 19 states and a federal capital territory, a bit like Washington D.C., built from scratch. Lovely idea, and they could have left it like that. Then they created 2 more, so they're 21. And then just before I left Nigeria, they added a few more. There's 32. It's like every reason politically and ethnically they decide to carve out another state, and none of the states can function on their own. They all depend on the federal government for funding. So they pretend to be like, you know, sort of American model, you know, autonomy, what is of central control. Most of the funding comes from federal government and oil money. That's still what makes Nigeria.
Oh, is Nigeria's oil rich?
Yeah, well, the southern part, but in fact, where I come from, in the Delta, the Niger Delta areas where most of the oil comes from, and from the late 60s into the 70s, Nigeria went into sort of prosperity boom because of oil. And in addition to that, though, it is a very large country, a huge population that's continued to grow, and it's resulted in they've got the resources materially, number of people, especially young people, with a drive. Nigerians are crazy like the Americans. Everybody wants to achieve something. You know, there's something about, unfortunately, a very corrupt system seems to prevent Nigeria from ever rising up from where it's supposed to be. But that, again, is a whole other topic. But
Sure.
We talked about that before in other podcasts, just how that the government subsidy or corruption or regulation can completely tie down all other equalities that could be with transportation and labor and things that can develop technology, etc. But I wanted to drop this fun fact for you, Zach, because that way you don't have to play the ignorant game. Let's talk Nigeria. So Nigeria is 1/10 of the landmass of the United States. Now I think we're including Alaska here too. So
you have to include Alaska, yeah, to make it 1/10. Yes,
deal breaker. Population-wise, it's got about 2/3 of the population of the U.S. So we're talking 320 U.S. versus about 220 Nigeria million.
Yeah.
I mean, that's a lot of people. Now, is that – but also when we – again, in the Western world, we think of Africa in terms of history, geography, and resources. We don't really see it in terms of logistics, population density, topography, all that kind of stuff. That's got to be that 220 million has to be in even like super condensed areas, right? I mean, how? I think more of the cities.
I think in the United States and Canada, and Russia, these countries are spoiled in that you've got a huge landmass, and so you get the impression that to have any number of people in any other country, gosh, you guys must be living on top of each other. But no, the population density in Nigeria is nowhere close to what it is in the UK or Germany or France. Most African countries do not have a population density anything close to what you find in most of Western Europe. And the population density of India, Japan is like they are living on top of each other. But in Nigeria, there are quite a few large cities. Obviously, you know, Lagos, Kano, Kaduna, Port Harcourt,
Ibadan, is it?
Ibadan. Well, funny enough, Ibadan used to be the biggest city in West Africa back in the 50s, and they held on to that. But Lagos, by far, I think.
So you did prove me wrong, because I'm looking at the population of these three, and it's about respectively 8 million, 3 million, and 2.5. So I mean, those are big, but you know, when you look at the U.S., New York City, what would you call it? 11, L.A., 8. You know, there's bigger cities here. So I think that kind of reverses my mindset on thinking that the small landmass means it's condensed in these areas, because these are not, by world global standards, these are not mega cities where you've got Mumbai of 20 million with the highest density on earth. You have Tokyo and Shanghai that are 25 million, Mexico City,
Manila in the Philippines. Actually, the thing is, Nigeria is a large country. It has a large population, but it is a large country. There is plenty of space. And especially in the north, you will drive, oh gosh, you can drive for miles, empty space, a savannah and all whatnot. It's huge. It's just that when you compare it to a country like the United States or Canada or again Russia, though these countries are huge beyond the general proportion of what any other country is. I think I might want to throw in Brazil, because Brazil is also very large and he's got the Amazon forest and things like that. But for the average country, Nigeria would be considered quite large, even by landmass.
Yep.
Does Nigeria have a lot of wildlife, safari and stuff, or is that not so much that area of Africa?
It's got some, but nobody goes to Nigeria for wildlife. People go to Nigeria looking for business. If you want wildlife, you go to South Africa, you go to Kenya. You know, those are they've got the safaris and things like that. There is the Yankari Game Reserve in the northwest of when I was growing up. I don't even know if it's functional now, because not much in Nigeria lasts very long. Then there's something new. What's the latest trend? They get rid of that and they do something else new. But it's not really a tourist country. It's mostly business. So we have a lot of foreigners there, but they're all there on business, not for tourism.
You know, when I was growing up, it was actually a very large missionary country for the Christian Reformed Church. When we would have, did you hear me?
No, I didn't. Sorry.
Oh, yeah. When I grew up, I grew up in the Christian Reformed Church, and Nigeria was actually a very large Christian Reformed missionary location. That's how I was, before even school, exposed to what's Nigeria. Oh my goodness, this is Africa. This is a foreign world. And
interesting. Wow.
Yeah. So I actually had families in my school and church where their parents were like missionaries. So it's like they were dual citizens, like they were born there, but they lived here. It was pretty wild. So I guess long story short, I don't get to speak to many Nigerian heritage people. So this is great. You sharing your story a little bit, and
they're everywhere, to be honest. Nigeria, there's a joke that if you go to the Antarctica or North Pole, you see a black man, he's probably a Nigerian, because wherever we're just everywhere, and it's almost a joke, but it's close to reality. Statistically, I've heard before that 1 out of 5 blacks in the world is a Nigerian.
Really?
55 countries, 45 countries in Africa. And when you include the blacks you find in Brazil and in the United States, of course, and add it all up, but the population density, the number, it's a numbers game, basically. Just like 1 out of 4 people in the world is Chinese. But 1 out of 5 black people in the world is Nigerian.
Interesting.
Yeah. And
that is
all over the place.
See, we're learning something tonight on.
I didn't know we were going to come into this interview and learn that, but I'm glad I did. I think that's going to be helpful.
Me, because that's an old statistic.
So Dr. Greg, he's suggesting that the next black person in Orlando I walk up to just say, "Hey, where are you from?" I'd say Nigeria.
Well, generalizations are wrong. All generalizations are wrong, including this one.
They're going to say they're from Pine Hill. Stop it.
Great. So let's keep moving through your story. Were we really getting into your education at this point, or you come back to Nigeria, right? And you decide at 14 you're going to just fall into this, and then how is in America, right? You get your undergraduate degree, and then you go into your medical school and all your testing, your residency, and you're probably somewhere out as a GP or an internist, maybe 32, 34, and then whatever specialist type of additional training. What's that like in Nigeria? Is that a similar process? Just so I can get your exact age here down perfectly.
It's different. It's different in Nigeria because Nigeria is a former British colony, and across the so-called Commonwealth, these are countries that were former colonies of Britain. All of them, apart from the United States. The United States there were 13 colonies, but there was no United States then. So by the time it became the United States, it was no longer a British colony. But the rest of the so-called huge British Empire, they made everything run their way. You drive on the wrong side of the road, you all speak English and stuff like that. And your education system is the same. Though Nigeria did flip in 72, they stopped driving on the wrong side of the road and they drive on the right side of the road like everybody else. So the education system is the same, which is you go to elementary school first, then your secondary school, and then you go to university. And as is the case in most other countries, as a matter of fact, you go to university to study whatever specialization you want to go into. So it doesn't matter whether you want to be an architect or a history teacher or a doctor. You go to university to study history or architecture or medicine. You don't go to a college to study, get a 4-year bachelor's degree in one thing, and then go back to another college to get a specialization as a law school or medical school. That's just, I think it's a throwback to how it used to be a couple of centuries ago. But in England and in most parts of the world, it's all been narrowed down. You go to university, you study one course. Of course, you stay in university longer. So a 4-year degree, if you do engineering, it's going to be a 5-year degree. If you study medicine, it's going to be a 6-year degree. So some of the specialists, the ones that are more specialist oriented, you stay in university longer, but you just go to one university, come out with a degree in that specialization. So that's what I did in Nigeria.
And was it always in emergency medicine?
No, emergency medicine was something I'd never even heard of at the time. Well, I don't want to give my. Well, I left medical school or university in 1991, and as at that time, emergency medicine as a specialty did not exist in Nigeria. It started in the UK in the late, I would say, 80s anyway. Same thing in America as well. So it's a very new specialty. So when I went to England in 96, and at that time, the show ER from America was very popular on TV, and I watched it a few times, and I did some rotations in emergency medicine while I was trying to get into my surgery training. I wanted to be a surgeon. I found this looks interesting. I like this, and I like the excitement and all whatnot, and I got bitten by the ER bug. This is when I was in England, and then I became so there was no emergency medicine in Nigeria. In fact, when I used to tell my colleagues in Nigeria, when I went back to Nigeria to visit, what's your specialization? Oh, I'm training as an ER physician, or accidents and emergencies is what it's called in the UK. They wouldn't know what I was talking about, then I have to explain it to them, because in the ERs in Nigeria, it's run by the orthopedic surgeons.
Really?
Yeah, orthopedics and trauma runs the ER. ER is like a subspecialty under orthopedics and trauma. The same way the ICU is a subspecialty under anesthesia. Most physicians are aware of that. In emergency medicine in Nigeria, it's orthopedics and trauma runs the ER. But it's changing though. It's becoming more like the British, where it's come a specialization zone. Because I'm dating myself. This is 30 years ago. It was different back then.
Oh, he gave you a little hint there.
Okay, I've been in practice for 33 years. This year.
I think I'm very, very close. So.
Very, very close.
Nice. Have you watched that new show called The Pit?
No, but I've heard of. I keep seeing the ads on TV. I think it's on Netflix. I don't watch a lot of Netflix.
No, it's on Max. Show the HBO instead of Max. Yeah.
I see. Yeah.
Yeah, my wife and I watch it. It is.
Is it good?
Yes, and I was with I was doing an estimate at a doctor's house the other day, and he's emergency medicine. He runs the ER at the hospital down in what's the one by you, Derek, in Windermere?
Oh, there's an Orlando Health. Just
no, it's Advent. It's Advent.
There's an Advent up by Winter Garden Village-ish.
Yeah, that's he said it was Winter Garden. Yes, you're right. Yeah. Anyway, and I asked him. I said, "Have you seen The Pit?" He goes, "I have," and he goes, "That show is spot on."
I like that.
Yeah, and I watch it, and I get anxious just watching. I was like, I couldn't handle it. No, not my calling. You cut your artery. I'm sorry. I guess you're gonna die. My bad.
I think. Well, but,
I mean, I have great admiration for that, because I mean, the ER is like, I mean, you guys are saving lives. It's not like I went in with a toothache. I went in with I'm bleeding internally, or I was in a bad crash, or
well, somebody was asking about this very question earlier on this evening, as a matter of fact, and somebody I met. A lot of ER is monotony, and it's the usual stuff. And there's a lot of people who come into the ER who don't need to be in the ER,
right?
And stuff like that. You just have to deal with it. And in the midst of all that, something really big happens. A guy comes in coughing about blood. Another guy comes in with chest pain. He's having a heart attack, or someone's having a stroke. And there's all that buzz and excitement, which is the part of emergency medicine that I guess I liked, the more serious acute cases. But it's not what you see all the time. Majority of your 12-hour shift, you're doing stuff that,
I believe this is the segment where we ask the doctor, ask the ER doctor. I'm going to ask rhetorically, and I'm going to expect you not to really answer, but maybe allude to the most disturbing thing you've ever seen in the ER. And my my father-in-law was an internist, and started working in the emergency room, and the stories I heard from him were enough to have me where I shouldn't be asking this ever again, in terms of people's heads run over by vehicles, just insanely tire marks on faces, just things that would, disturb the average person. But I'm sure there's a part of that exists, Dr. Adaka, right? I mean, there's moments of that where you see maybe things that for the first time you didn't think you might have ever seen in your life, right?
It's funny, people ask that. It's
a great question.
I think it's because I've been doing it for too long. Maybe that's why.
Yeah.
So you get to the point where nothing can shock you. Maybe that's what it is. Because when you would think I'd be able to, oh yeah, that terrible thing I saw that day, but it's been a lot. It's been 30 years, and you see, and then sometimes you see things that that shouldn't otherwise bother you, and maybe that's when you think, I think I'm getting old. Because when it does bother you, yes, I've seen a kid with his arm cut off. I've seen a foot so rotten you could see the bones in it with gangrene. Just gunshots, horrible injuries, horrible burns.
Yeah, I think that'd be the worst.
Nasty stuff. And then, of course, if it's children, that's why I don't like pediatrics. I don't like to see children suffering.
Right.
But to show you how this can play on your mind, and as I said, maybe I was getting older. I don't know. This is about around before COVID. After COVID. So 2021 or so. I came on shift. I needed something. I can't remember, it was a mask or something. And the nurse who was doing the I think she was about to start the shift or finishing the afternoon shift said, it's in resource just by the, cupboard or whatnot. So I stroll into resource with her. There's a body on a gurney and it hasn't been properly covered up. So earlier on, somebody had passed away. They'd done all the stuff, chest compression, shocked, all the stuff. Didn't work. Person had died. I wasn't there when it happened on the previous shift, but they hadn't yet moved the body to the morgue. So body's on the gurney, covered up. I just walked in. Nurse was walking ahead of me. I said, hey, what happened here? And I sort of thumbed the body. Said, oh, yeah, I had a crash, arrest, this, that. Described it in a few colorful terms, I grabbed my mask and everything. And I'm turning around to walk away. And I just thought, that is a bit of inane conversation. It's a body. This is somebody, human being. Right. I just so casually asked the question because what's happening? Am I that? And in that moment, I kid you not, I almost wanted to cry.
Because you felt like you had become almost so desensitized that it was inhumane, right? Because but how we see it is we see you as a special type of person that I could not be, right? Well, I could if I told myself for long enough, but I don't feel like naturally that would be something my body could handle, seeing or digest. And what I mean by, if you were to throw that in front of one of us, that it'd probably be vomit, pass out, just a very messy occurrence where, you're seeing these things all the time and you've become so, I guess, objective to what you're looking at that it's like, oh yeah, what's this case? And you're like, an hour ago, that was a soul.
Right.
Living.
Right.
And now this is a, like, we talk about women being objectified or people being treated like animals or inhumane objects. And now you're like, I feel like you're telling yourself, like, am I a horrible person? Because you're desensitized as a physician, and you have to be.
That's the thing. You have to be desensitized, but you have to maintain your humanity. Because you still have to connect and still have to have that passion that makes you want to do the right thing because that's another human being.
Yeah.
You don't have to be so sensitive where you can't function because you fall apart when you see somebody dying in front of you. It's that balance, which you do it for so long. And then I don't know what happened that evening. I don't know why. I felt like crying and I pulled myself together and then a moment passed and that was it. And I thought to myself, am I getting too old for this? That's what crossed my mind. There's one thing I feel that medicine has done for me, and I think it does for many people though as well, is when you see the reality of how fragile life is every day. I don't mean people die every day, but you see sick people every day with cancer. You see illness every day. You walk home back to normal. It makes you view the rest of life sort of differently through a different lens. So when you see people getting upset about, he cut me off when I was driving and this,
right?
And you should be happy you're alive. It's like it changes your perspective on life and makes you value life and take life a bit less seriously than many people do. And as people get so upset about some of the things they shouldn't get upset about, or people being very proud. I've achieved this. I got done. I think you don't know whether there's cancer growing in your body. You could be dead next year. You just don't know.
Right.
I saw it in the ER just today. It's that sort of thing. It changes your perspective on life, and I think it gives you a more balanced view on life, I think.
I have two thoughts to add to that, and one, I guess to add to being a special person to handle that. I think that if you took an average person like us and put them in that situation, and we threw up and passed out and couldn't handle it, and then you put it in front of us 1,000 times, and we weren't meant to be that special person, we would become that desensitized to where, you know, the wrong person. I envision myself where I would lose my humanity. Like I would just, because the only way to cope would be to treat it as like a, you know what I'm saying? So that's why I say that. Second point, oh my goodness. Oh yes. Just to relate to your perspective of the scaling of issues, of problems, of the importance of life. It was for me maybe like about almost 10 years ago exactly. I got in a car accident, and it was a nice car that I put every mile on, and it was totaled. Someone totaled me, and I had some burns on my arms and just coolant leaking over my face, and I had to kick open the passenger door to roll out of the car. And when I kind of got my conscious thought back a little bit more, I was virtually kind of untouched. And when I watched that car be hauled away, that car meant nothing to me all of a sudden. Before it was like, oh, I like this car. I've taken such good care of this car. I put so much time into this car. But when the car died and I walked away unscathed, ever since that day, I've had very nice cars, but I could give a rip about the car. I don't care about the car.
Changes your perspective, doesn't it?
And so what you're saying there is I work, around cars quite often, and I come across people who are so in love, I'm sorry to say, with a piece of sheet metal. And in the best statement I ever heard that I still relate to this day is, it's just a piece of sheet metal.
Yeah.
You're free to enjoy it and be comfortable, but at the end of the day, guess what? It's if that car dies and you're safe, who cares? Who cares? So are you
equating dead bodies to sheet
really
metal, Derek?
What's that?
I said, are you equating dead bodies to sheet metal?
I'm just trying to kind of like relate to what he's triggering in me in terms of like how I understand that. That makes a lot of sense. And when people are like getting upset about the stupidest thing when the world is burning.
Right.
Exactly.
I get it, but at the same time, like I'll, we all get mad sometimes. Like someone cuts us off, like but then like if you have that perspective, you're like, okay, anyway, next, right? You just keep going. It's like, okay, there's other things. So
now in your new position, you're in charge of the prison. Is it prison or jail?
It's jail, county jail.
Okay, county jail. All right, so less than a year.
Officially.
Yeah, allegedly.
But it's the fourth largest system, you said.
Yeah, there's several jails three jails within the system, because Miami is a big city. The biggest, I believe, is Rikers in New York. Rikers, LA County Jail, then Chicago, Cook County, I think it's Cook County, and then it's Miami-Dade County. So it is the fourth largest.
Wow. So as the director, are you more in neck deep in paperwork than actually getting out and seeing patients? And
absolutely, paperwork, administration, keeping it running. I'm not the most senior person there. There's a chief medical officer who I report to, and she has been doing corrections medicine for more than 30 years, for as long as I've been doing emergency medicine. So she has oodles of experience, fantastic person to work for. She's my boss. I'm her associate, so to speak. And 2 years into the job, I'm still learning a lot. But yeah, you're dealing with people, and administration is very different from dealing with sick people in a bed. You're handling staff, handling issues, and it's a different kind of stress, and having to try and make things work with people who are in a more senior rank than you, with the county, with the Miami-Dade corrections and everything. But we make it work. We have to make it work. It's challenging, but it's a different kind of challenge than I have faced in the ER. And no matter how difficult it gets, though, I always remind myself, well, at least I'm out of the ER. So, that's
but I'm sure you've seen some stuff there, though.
Not so much in the jail. People often, I mean, because it's a county jail, it's not a prison. And,
that's a little different, I'm sure.
It is. I mean, I've heard a lot about what happens in prisons, and it's again from people who've had some of those experiences. And although a jail is a jail, a corrections facility is a corrections facility, but the sort of injuries that you get there, and things that happen to the inmates and whatnot, it's nothing worse than what you see in the ER. In fact, what you see in the ER is usually far worse. We do have a pretty robust healthcare system within the jail facilities. In fact, I would say about 1/3 of the members of staff you see within the jail belong to the Correctional Health Service, wearing the blue uniforms and stuff like that. There is a lot of the presence of healthcare professionals in the jail system, especially psychiatry. So you feel like you are in some sort of hospital rather than jail, except when you go into the cells, of course, and then you remember where you are.
I would imagine it's almost like its own little city.
In a sense, one of them is Metro West, but that's the largest one. It's more remote than the other two. It's more of a purpose-built facility, but all of them are. It's a different world once you're behind bars. It's a different world. I wouldn't wish it on my enemy. It's just not right.
Right. Yeah.
There's a whole other set of stories about that as well. But considering one, it's a county jail, and because for the last 10 years or so, it's been under some sort of consent decree under the Department of Justice. You'd be surprised at how many county jails across the country are under some sort of consent decree from Department of Justice for not getting things right. And so when I came in 2 years ago, I came at a time where they're almost about to come out of the consent decree because they've made so many corrections and improved so much. So I heard about what it used to be like, and fortunately, I came in when it's a whole lot better run, better services. Sad reality is that because of the demographics of the people who are behind bars, these are some of the poorest of the poor. A lot of them are homeless. We have a huge psychiatric population behind bars. In fact, we have a larger psychiatry unit in the jail system than we do in the county hospitals, about 3 times bigger in the jail, because there's so many people who've got psychiatric problems who are behind bars. And so you find people who are, before they came to jail, don't have any health care. And sometimes coming to jail, in a sense, has saved them, because now they've got health care they don't have to pay for. You can see a doctor when you need to see a doctor, and you get taken care of. They pick up things that, I mean, a number of times you picked up people who had cancer and they didn't know till they got to jail, and then complained of some symptoms, and it was able to be picked up, sometimes too late.
Right.
But people who otherwise would not even get healthcare had they not been in jail. And that's just a sad reality of healthcare we have in this country.
Well, before we jump onto that subject, because I know that that's near and dear to your heart, I got to ask you, this is off topic for a minute, but I met you at Podfest.
Yeah.
What were you doing there?
Well, I like podcasts, don't I?
Yeah, what were you doing there? Let's talk about
what were you doing there? You're a doctor. Come on now.
Listen. We're talking physician, speaker, author here, right? So
yes.
Somebody
I was blown away. I was blown away by how many book seminars were there for authors. I did not realize it. I thought it was just going to be a bunch of us mic jockeys, Nope. And it turned out to be it was amazing. I mean, I went Wednesday, Thursday, Friday, Saturday. I didn't go Sunday because it was an hour and a half long, and I wasn't driving and dealing with that nonsense. And people joke, "Oh, but you live in Orlando." I go, "Yeah, but everything in Orlando is an hour away from
an hour away."
So,
I know. Yeah. Miami, right? Yeah.
Yeah. So, I mean, I was blown away, and I went to classes that I thought I was going to get so much out of and got nothing. And then I went to classes I said, this will be fun to go to, and I got tons out of it.
Sounds like university.
It's not like college.
So do you I know you're an author, and we can promote your book here for sure. What else were you there? Do you do a podcast?
I don't, but because of my this recent, let me say, so to speak, interest in podcasts and public speaking, I thought this would be nice to go to. And I got this invitation from the OWL people, who I met at a TEDx event last year.
Okay.
where I was interviewed, like you were interviewed actually, by the OWL team, and so they reached out to me and said they liked the way I spoke and everything. Would you mind being an interviewer at Podfest? I said, I've never heard of Podfest. I said, you just sign up, buy the ticket, turn up, then you can do your interviews and you can enjoy Podfest. And as soon as I read what Podfest is all about, I thought, wow, I'd love this. There's going to be lots of podcasters, lots of speakers. I love the topics they were discussing, everything from, a good microphone setup to how to present, how to reach people, how to respond. There's just, as you said, there's tons of things to do there. I've never been to any of these things before. And they said it's probably the biggest podcast expo, or the, if not.
I'm gonna go every year. I'm hooked.
Yeah.
Although it was like drinking out of a fire hydrant. I mean, there was so much, but it was so cool to meet fellow podcasters, creators, everybody. But then you met some of these like more famous. Now, obviously, Joe Rogan wasn't there. I mean, to me, he's the godfather of podcast. But all the other people there that are famous were just so like.
Just right there.
You were just able to just talk to them. They were normal, everyday people.
Yeah.
Matter of fact, I've got a couple of them who are going to be on our show. And, I just found, I'm like, why is this guy I'm nobody. And then, then you get to realize, wait, they started out where I am. And now they're kind of giving me here's your shoulder up, Bo, let's go.
That's it.
Yeah. So I was just wondering, because I'm like, all right, I got invited to go get interviewed on OWL. I met you there. I don't remember your co-host name because I hit it off with you and not your co-host. He was too busy flirting with the little girl.
I'd never met him before either, JR.
He was a nice guy for sure.
We met on the table, we got talking, and then interviews just went off like that. I mean, it's podcast or Podfest, so you're going to meet people who can talk. That's basically what lots of speakers like yourself and everything. And that's what I found very just refreshing, that everywhere you looked, everybody you talked to, they had something to say, and they just go off on one, that was.
And everybody was so supportive and gave great, not criticism, constructive criticism, where they would say, hey, maybe you should try this and tweak this. And I'm like, aha. So, my co-host said, he was very excited when I came back. I was all fired up. But I know, Derek, you're chomping at the bit. You have some more questions, don't you?
No, I'm enjoying you, to be honest with you, and that's no offense to our esteemed guest here. By the way, is a big deal that we're just talking to, which is fantastic. You're on fire, man. I love what you're saying, and I love how I texted you this, but the flow of how you're doing this is so wonderful because we can get caught in the minutia for hours, and it's enjoyable. But I know that Dr. Adaka really wants to go into kind of where his passion is going. And what I understand, correct me if I'm wrong, it's kind of how healthcare is and is now working in America based on technology, accessibility, drug development, throwing money at problems, and really what is going on, right? Because we have the resources, we have the money, we have the system, we have the structure, but it's almost like we talked about this the other day too, Zach. It's like we're throwing more inefficiency at the flame. We're fanning a flame instead of like how do we effectively put this out? How do we effectively deal with the situation? And it's not adding 500 D players. It might be what 10 A+ players can do, right? So I want to really just let Greg go wild, Dr. Greg go wild on this subject and just really tell us the solution in the next, I'll give you 10 or 11 minutes to solve it. And then we
got a clock going.
We can forward that back up to Elon for you up to Doge.
Now you're talking.
And then we'll be able to sign it, do it. We'll be able to address a different subject tomorrow. So
yeah, that's right.
We're going to fix the medical world problems right here, right now.
11 minutes. Right we can now. 11 minutes. Yeah. The way you described it just now, something you said reminded me of what another physician said on another podcast I was on. And first off, disclaimer, I am American. I know British, Nigerian, all that, yeah. But I'm American now. I fly the flag. So I'm going to speak about my country.
Beautiful.
And if you don't like it, leave. Isn't that right, Zach?
Lex. Don't make me get the dark.
Don't
magazine.
tread on me, baby. Come
Don't tread
on.
on me.
I'll show
Don't
you
tread
the
on
door.
me. I see that flag. I can fly that flag now with pride. Now, here's the deal, though. This chap said, this doctor said, what the American healthcare system is like a fantastic restaurant, a very expensive restaurant, where you've got the chef and everybody cooking the best meal in the kitchen, and you've got all these people waiting at their tables, and nobody's able to get the food to them, except a few scraps here and there. And I said, that's a very apt description, because it's, as you said, it's not as if we don't have the technology. Some of the best medical technology exists here. So many robotic surgery, treating cancer with genetic, and all. I mean, it's most of the stuff is invented here in America, and then gets to other Western countries later.
You would think Japan or China, but I guess.
Well, I mean, I'm not saying we've got the monopoly of innovation, but
no, I'll take it. We got it.
Yeah, no, honestly, the majority of medical innovation. I can't take you seriously, Zach. The majority of medical innovation does start in the United States.
Yes.
And nearly 50% of new drugs that come to market are developed in the US. The second largest, the country that does the second largest, I think it's either Germany or the UK, and then Israel. We're talking 10, 15%, so 48% of all new drugs come from the United States. It's just, this is where it's at. We spend more money than any other country. And I don't mean because we're the wealthiest country in the world. As a proportion of our GDP, we spend more on healthcare than any other country. Now, with all that being said, you would think...
But we got more sick people than everybody else, too.
Well, I don't know about that, to be honest. I mean, it's a bit of a misconception. I know that we've got an obesity crisis. That's true. We eat horrible food here. You name it. Yes, but that can't explain everything. That can't explain why I give a off the bat example. When I used to work in New Hampshire, I'd been in America for only about 3 or 4 months. A girl comes into the ER, has some sort of sinus infection. I prescribed an antibiotic for her. She left, and about 30 minutes later, I get called by the ER secretary. She says, "You've got a phone call, doctor, from the pharmacy up the street." That was odd. I'd never got a phone call from a pharmacy before. I picked on, yep, Dr. Adaka, what can I do for you? So, no, there's a girl here who said you wrote her a prescription for Augmentin. She can't afford it. Can you give her something else? And I'm like, what do you mean? She goes, well, it's $64. Well, that shocked me. Why would Augmentin be $64 in the first place? She hasn't got insurance. She's a young girl. She works. She doesn't have insurance. She hasn't got $64. Can you give her something else? I said, no, I can't. Give her the other. It's what she needs. I just come from the UK, right, where everything is free. So I'm trying to figure this out. I've heard about America. I know what it's like here, but surely there's something you could do. No, she hasn't got $64. Can you write her something else? I said, like what? He said, well, Keflex. Well, that's not going to work. Well, that's cheap. All right, give her Keflex instead. I hung up the phone, turned to the nurse beside me, and said, this reminds me of practicing medicine in Nigeria. I'm in America now. So that discrepancy between what we have and on our inability to give it to everyone, that is what is so it's disturbing. And it's the fact that I think most of our fellow Americans are not aware of just how bad it is, because this is all we've ever known. And when you think about how medicine is practiced in other countries, think about all the jokes they make about Canadian healthcare, or the National Health Service, or Ronald Reagan called it socialized medicine and everything. We always think it's worse out there. Everybody comes here. Till you look at the stats, and then you realize our healthcare indices are pretty poor. Not just poor because we should do better, we have more money, but poor compared to everybody else on so many indices.
Sure.
And I know we have on a healthy lifestyle here, but for crying out loud, there's an obesity crisis in England as well. I mean, everybody in the UK complains of how bad the National Health Service is, but sometimes I just tell them, you need to shut up and put up, or go to America instead.
Right.
You run back with your tail between your legs and say, give me my National Health Service. At least I can get it without having to, remortgage my house. And
well,
that's the difference.
I have to agree with you because little background. 7 years ago, I had to have brain surgery.
Oh, wow.
Well, my wife wanted proof. No, I had what's called trigeminal neuralgia.
Okay.
Which I was one in 15 or 20,000 people under the age of 50 to have it. It's a very rare, it's an old man's disease.
Well, it is, isn't it? Yeah.
Yes. Well, I was under 50 and I had it. And so I had to go through, so I had it before I had the surgery. I had it for almost 6 years. I dealt with it. I was on the highest allotted dosage of gabapentin, Epital, and Lyrica allowed by the FDA. That I was at, or whoever allows it. I was at the maximum, 3,800 milligrams of gabapentin a day, 800 milligrams of Epital, and 200 of Lyrica. And everybody couldn't understand how I even functioned, but I'd go to work every day, And if I hadn't had insurance, I don't know that I would be here, because they don't call trigeminal neuralgia the suicide disease because it's a joke. Most people kill themselves who have it.
Poker in your side of your head.
Oh, it's the worst. But when I went in for brain surgery, now you talk about amazing things. Laparoscopically, robotically, they went in. Yep. Microvascular decompression.
Wow.
Filled the area with foam. I got to see it. It was amazing. No, I didn't watch it while I was under the knife, because they knock you out for sure. But I mean, it was really impressive. Have the surgery on Wednesday, go home on Saturday, home for 20 minutes, sneeze, blow a blood vessel, brain bleed, back to the hospital. Now this is 7 years later. I found out that that's actually a very common occurrence after brain surgery, because they've opened everything up, and arteries and blood vessels are weak now. And anyway, so I had a stroke, for calling it for stroke's sake. Spent 9 days in intensive care, almost in a medical coma, because the pain was so horrific. And again, if I had an insurance, I saw my hospital bills. I paid out of pocket $2,500. That was my deductible. I covered that. The surgery itself was close to $750,000.
Incredible, the numbers that you hear in the US.
Right. So I totally understand it. So at one point in time in my life, I was actually thinking, you know what? Socialized medicine might not be that bad of an idea, because there's people out there who are dying because they can't get insulin. So after the surgery, my blood pressure, my blood sugar was all messed up, because when you have a stroke and then you have a brain bleed, your body gets all cattywampus.
That's right.
And they put me on blood sugar pill called Jardiance.
Yep, the fancy one.
Without insurance, it's $600 a month.
That's
for
it.
30 pills.
That's it. For
$600. I didn't have insurance for a little while. I said, I'm going to stop taking it. My doctor says, no. Call this number. It's whoever owns Jardiance. Right. Anyway, I pled my case to him. I got a year's supply for free. Okay. Then why are you charging $600 a month?
Because I can.
Exactly. That's
which tells you that the pricing, it's like simplified pricing. It's not based on cost. It's based on need, which we know is true of the airline industry, and we complain about it all day as pure evil. But we also know it's true in the farm industry, because they take all that R&D money, they spend the snot out of it, race to get that result, everything approved. Once they do, they got to milk all the profit they can out of it before that patent expires and it becomes generic. That's the cycle.
So people look at me and go, Zach,
and I'm not justifying. I'm just saying they know.
No, and I agree with you. But people look at me sometimes. They're like, "But Zach, you're conservative. How could you even think it?" I said, "Wait till you have brain surgery, then come argue with me. Wait till you see your bills. Then you're gonna go. Maybe I'm gonna move to Canada. No, I'm not moving to Canada.
So if you can't pay for that surgery, so you can't pay for that surgery, and you can't be denied. So essentially, you go get the surgery. There's no way you can pay for it. You just declare bankruptcy and then move on with life.
Right.
Well, that's just fantastic.
Right. Let's just put more.
As Dr. Greg said, all problems in perspective. Who cares, right? That doesn't matter at all.
What you raise an important point, Zach. You're raising an important point. And many people don't seem to. And sometimes it's only when a disaster like this occurs that they sort of. There was a guy in a church I attended. West coast of Florida, and it was a very conservative church. And he was the one. I mean, everybody loved him in the church. He was a part of the fabric of that church. But because of what he went through medically, I heard him speak and I thought, wow, this guy sounds like a liberal. But he said his whole attitude towards healthcare had changed because of what he went through. And he became an advocate for the government doing more to make healthcare available to everybody because of what he went through. And sometimes, unfortunately, people don't realize how much. I mean, it's easy to be an ideologue until you sort of suffer. The real ideologues are the ones who go through it and suffer and still want to hold on to what you believe in. I'll die believing this. Well, fine, that's a real ideologue. But most people, if they face the trauma that results from what they believe in, they'll change their beliefs, believe something else instead. I find that just to be, real about it's just human nature.
Oh, 100%. 100%. My daughter, second oldest one, got her first job, and I'll never forget when she got her first paycheck. She's going, Mom, what is it? Where did my money? What?
Oh, my money's gone. Oh, yeah, now you know.
Yeah, and she instantly went from being a liberal to a conservative.
We're thinking of, the joke. I mean, what's a conservative? Isn't it a liberal who got mugged? It's
exactly
who got a job, yeah.
Or a liberal who just got her job, her first job. When you realize, oh, this is what they do with my money. That's why I choose to be neutral, neither liberal nor conservative. I don't know. Is it possible to be that way? I think I am.
You can be a libertarian, right? I mean, you're just kind of like centralized tiny government, whatnot. But it doesn't sound like in this case that's necessarily, with socialized medicine, that's the solution either. We had a similar thing as you, Zach, with medication when my wife had her massive clotting in 2013, and she was not employed for a brief moment when that happened.
Wow, no insurance.
We got it somehow for the hospital stay, which was good because it was a week there, and then we spent 3 days at Mayo Clinic too. So we figured that out. Which Mayo Clinic, by the way, fan-freaking-tastic. I'd go there without insurance. I don't give a crap. The admin layer is like you. There is no profit suckers. It's just beautiful. But I digress. So at the time, she had, came out of that hospital, and they had to take her what do you call that sugar reading? It's a 3-letter, her RC or her whatever.
A1C.
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 No. That's
not
whatever the blood thickness.
INR.
INR. Thank you so much. Boy,
we have a doctor. I mean,
that's the Indian currency. Her INR, and so she was, at the time, prescribed warfarin Coumadin, and she had more clotting, and so it wasn't a anticoagulation; it was a blood thinner solution, and that was new medicine at the time, 2014, and the new drug was Xarelto. Xarelto didn't have a generic yet. There was no Eliquis yet, which is, I think, a better drug even, and she wasn't employed. And so, of course, it was very expensive. And, we're thinking, geez, okay, all right, fine. It's going to be what, $300-400? I don't know how much it was. I don't think it was $600, Zach, but it went cheap. Mm-hmm. And yeah, they had a little care card from, I don't know if it was Merck or Johnson and whatever, the pharmacy. And sure enough, they said, okay, cool. For a year, you can get it for free. It's like, okay.
For free?
I think it was like nothing. So we know it's not a cost-driven thing, right?
It's not.
So how do we take all this profit and all this money, and how do we spread this? Dr. Greg, let's solve this tonight. How do we spread this socially so that people can get what they need? Nothing more, nothing less. You don't have to prescribe alternatives that aren't going to work, and it's just contributing to the waste at that point. And make this a more efficient system where everyone can win. Instead of just the drug company.
The drug companies, they're winning in a big way right now. But you realize that only 15% of healthcare costs are drugs. So there's even 85% of the costs is so many other things. But starting with drugs, at least that's something you can pin down. In other Western countries, you may either have a single payer system or some sort of system where the government, this is the beauty of government, as much as we hate government and I hate taxes and whatnot, but there's some things that government can do. And that is they can negotiate with the pharmaceutical companies, because if the government is covering the costs, they're going to be the biggest buyer. And you know what economics works like. If I'm the biggest buyer, almost like a monopoly, I can set the price for you. Almost. Or at least I'm in a much better negotiating position than if it's one guy here and one company there and one pharmacy there. If it's one big body that says, this is what we need, let's talk about it. I'm not saying I know you need your profit and you need to make enough money to do your research. I get that. Mm-hmm. But let's talk about this price. And as a matter of fact, that's what all these other Western nations do. It doesn't matter whether you're in Australia or Switzerland. They all got different systems, or even in Canada. So that's why in Canada, you can buy the same drug for a third of the price you can buy in the United States. We're being ripped off. That's the way I see it, because they agree with it, not because they need it for their. They always talk about they need it, but at the end of the day, they all make their profit.
But you want R&D to be private, right? Privatized, because you want to compete for that speed, right?
Of course, but I don't. When they say the R&D thing, I'm like, yeah, come on, don't pee my ear. Tell me it's one more. You don't. It doesn't. And R&D costs a lot of money, and there's a lot. And they do make big losses because they can spend hundreds of millions on a drug, and it doesn't work, and they go down another alley. Yes, I get that, but when your profits start become so small, you're afraid of going bankrupt. Then I'll get worried. But as far as you know, these drug companies, they're making huge amounts of profits, R&D or no R&D. And the United States is one of the countries where they make the biggest profits, because in the UK, NICE, the National Institute of Healthcare of Clinical Excellence, will tell the drug companies, this is how much we think is reasonable. Can we talk about it? And they agree on a price. They do the same in Germany. They do the same in Canada and Australia. They all do it in all these other countries except America. So the drug companies will charge what they can because they can. And what happens in the pharmaceutical industry is also, to a good extent, what happens across the rest of the healthcare industry. Companies, individual groups will charge as much as they can, not as less as they can, but as much as they can to make their profit. And healthcare is a bit of a gravy train. Having the insurance initially back in the 1940s was a good idea. The idea is that, we're here for you. We pool all the money together. So when you're sick, we'll pay for that. That's what insurance is supposed to be, isn't it? But it's turned into something else now. It's a money-making machine, and they're not trying to cover you. They're just constantly trying to make their profit. And rather than squeeze their profit, they'll squeeze you. And so,
which blows my mind, because from an insurance perspective, you do need to be financially healthy to make claims, and that's how you get your rating. You do need to collect. You do need to make more money than what you pay out, obviously. Yeah. But at some point, when you're fighting, and we live in Florida, right? So this is like injury accident lawyer mecca of the world, right? Every single. So I was actually in Fort Lauderdale on Monday and Saturday, because my wife and I were out cruising, so not too far from you. And that's a short 3-hour drive down the turnpike. And I said to her at some point, I'm like, do you notice that? We don't know Dan Newland. We know
John Morgan.
But I go, did you notice that? I hate absolutes, doctor, but I'm going to just still say it. Did you notice every billboard is an injury lawyer? And so my point is, at some point, don't you take into cost perspective payout versus how much they're actually paying for these lawsuits? Like, doesn't the proportion of lawsuit payout somewhat overweigh at some point the ability to just make your claim payout? Like let's say you deny $40,000 claims, and one of them sues you for $1 million and wins. You lost.
Well, they've got actuaries, they've got their statistics, they know what they're doing, because be that as it may, the health insurance companies are making a lot of money, shed loads of it. And the fact that they're making so much money and people are not getting the service that they need, coverage is constantly being denied. That's what the patients suffer. Doctors aren't able to practice adequately, because every time you want to prescribe something or do something, you want to get prior authorization. It's a nightmare for the doctor providing the service. It's a nightmare for the patient receiving the service and having their services constantly denied. The only group in between that seems to be enjoying the system the way it is the so-called health insurance companies. So either way, despite what you're saying, they are still making them. They find their way to make their money. And at the end of the day, it's profit driven. So it's not so much about heart or compassion and how many people can we save. No, it's not about that. It's about how much money can we make? How can we satisfy our shareholders at the end of each quarter? Because they are, big Fortune 500 companies at the end of the day.
And that's the problem with that is a huge, that ties into everything we're talking about, right?
Absolutely.
Privatized medicine versus socialized versus big public companies that are shareholder driven, where every decision is a tactical profit-based decision. And certainly profit is your most important KPI, if you'll call it, or metric at the end of the day. But when you shortcut decisions because of it, that actually hurts you in the long term. I'm very convinced. For example, when Disney became public and now they do all these little things for, the premium pass holders, that they cut out because there's no value add. You know, we're not going to do the magical express buses from the airport for the deluxe resort guests. They're going to have to contract through Mears Taxi. Does what you gain on that P&L really outweigh the psychological win that your clients or your end users have in this case, right? Is what you're doing to extend that profit by 0.1% really winning with people's perception of you, their willingness to want to sue you, just all this other stuff, or having a top executive shot in New York City? Does that outweigh that? And now we go right back to these. You're right. We're going right back to you looking at the body in the emergency room and thinking, hey, what's this? Well, that's what we're talking about with people now.
Yeah.
I think it wins in the short run, Derek, and everybody's focused on the short run, on the quarterly report. The long term, of course, everybody loses. And then you have the disaster like you described in New York. And everybody goes, oh, but yeah, people have been pushed too far. It doesn't solve anything, and I do not support what that guy did, killing somebody in blood.
But you can empathize with it. You see where his head was.
I see where, I mean, because I see the result of those decisions that these big companies make. I see every day in the PR. I must say, when you talk about solutions, a lot of my fellow Americans look upon what goes on in other Western nations, and they derogatory label socialized medicine. I think it was first used in the 1950s when they were trying to introduce Medicaid and Medicare, Roosevelt and New Deal and all that. But it was, I think, I first heard it from Ronald Reagan in the 1980s, and it's associated with the concept of socialism and communism. The Soviet Union, China, rationalized healthcare, where there's not enough to go around, but everybody gets a little bit, but it's never good enough, as opposed to America, where we have the best of the best. The reality is that derogatory term, I think it should be dropped. Just got government provided or government backed or government guaranteed. When you get the government to step in, and the government is the government that you voted into office, and they've got to stay in office, they need your vote, then they will generally do their best by your healthcare, because they know come the next 4 years or whatever, I've got a vote coming up. And there's one thing any British politician doesn't want to do is ever step foot on the live wire, the third rail, that's the NHS. As much as people complain about it, you don't want to do any, just like in America, nobody wants to touch Medicaid, because those are.
You made a really good point, with how we look at that term. Now, when we look up the term, let's say, the maximum amount our savings accounts are insured for is $250,000, right? There's always that proud statement, proudly backed by the FDIC, meaning your money's safe, right? It doesn't mean your money's regulated and controlled necessarily. It means it's safe to a certain extent. So
$250,000, it's safe.
Right. So switching that label from socialized medicine to government, like you said, government backed, government guaranteed, government insured, government regulated, or government supported, something that's a little bit more of a constructive terminology. Because for me, I'm gonna be dead honest with you. I'm extremely ignorant to how socialized medicine works, and hearing that term will automatically, and I might be more true red for terms of color than Zach is underneath. He just doesn't know it. I'm so closet conservative. But like, I hear that word. I hear the word and I cringe, right? Just because I don't like that word. I must not support that because that socialism is bad.
Yep.
Okay, socialism is bad, but is it the same thing?
It's not. I mean, I always try to let people know when you talk, for example, universal healthcare, which is now thought of as being like socialized medicine. The WHO definition of universal healthcare doesn't mean socialized medicine or free healthcare. It is defined as, this is the WHO definition, that everybody in that country has access to excellent healthcare anytime it is required without financial hardship. That's the definition. However the country is able to provide it is up to them. And how the National Health Service works in the UK compared to how the healthcare system works in Germany, they are miles apart. Germany is very much like America. They use insurance companies, hundreds of them. We think we've got a lot here. very fragmented and whatnot, with very little central control, a lot of independence, but the government makes sure that it works. The health insurance companies are not for profit. Drug prices in Germany are debated on every few years to keep them at a price that the pharmacists are happy with, because we need the money for our research. Think of all the big German companies like Roche and I think Sibel, Swiss. But yeah, they need enough money for their research. They need to make a nice profit as well. And the citizens understand that. But at the same time, you don't want to be gouged, the way they do it in America. And so at the end of the day, everybody gets health coverage. They've got 100% coverage. Every Western nation has got 100% coverage of their population with healthcare that is easy to access and does not put you under financial hardship. The one nation that stands out among all of them is the United States, where we have like 57% of the country has that sort of access that would meet the WHO requirement. 57%. Everybody else has either got some sort of insurance, but not enough, and about 11% have got no insurance whatsoever. But
so what's your thoughts on I don't want to hijack the conversation. I love it. What are your thoughts on pulling out of the WHO?
Well, it's like many of those things. I think it's just not a smart idea. Why would you do that? Why would you cut yourself off from all they have to offer? If you look at the WHO as something that takes from us, because we contribute money to it, and we contribute to their knowledge base. But why would you pull out? Whatever they have discovered, whatever other countries have learned, we can all benefit from it. We can all look at the internet. There's some things that work better when so many other countries are pouring into it to make it happen, even though the internet is first.
Do you think that's a backlash from a bitter COVID taste?
I think it's a bit more than that. I think it's a bit more than COVID was just, I guess it's part of the picture, but it's more like, listen, we're America, we can do it on our own, we don't need them. If anything, they need us. Get out of here. And you act that way until things go wrong. You suddenly realize, you know what, that information we had, do you mind sharing with us? But I hope we don't have another disaster that requires us to depend on the WHO. But there again, we've got so much we can contribute to the world through the WHO and vice versa. Sure. These organizations, I believe, are there. There's more good from them than there's bad. None of them are perfect, but there's more good than bad. It's like the UN. Don't pull out the UN with all the problems it has. Stay there and fix it. That's what I would say.
The UN does have its issues.
Oh, you're telling me.
I like your perspective though, because it's like an owner versus an employee mentality. The owner has to stay in and fix it.
That's it.
The
I think with the WHO,
but the problem remains.
I think with the WHO and maybe the UN, maybe they should work together as countries to come up with ideas and try and share them so everybody can pick and choose and implement what they want to, rather than them kind of saying, this is how you do it, or we're going to do it for you. And, I do, the UN's a peacekeeping group. I'm torn on that, because sometimes you don't stick your nose where it doesn't belong, throw your ideas, give your thoughts, with the WHO, you could have some mastermind, brilliant people together who can come up with some great ideas, but let everyone pick and choose what they want to implement.
But isn't that what we have already? I mean, with the WHO doesn't have the authority to make any of its member countries do anything.
Yeah, I mean, but don't they try still?
No, well, they would. I mean, if you've got any organization that says, I'm here to help you with your health care, like a doctor, to do this, stop smoking, do that. But he can't come and snatch a cigarette out of your mouth, can he? The WHO being
my
doctor might try, but we're gonna have problems.
Yeah. You know what I mean? So I don't believe they are, even if they want to be intrusive, they don't have the power or the authority to force you to do anything to your healthcare system. Otherwise, I mean, they would have corrected things.
Well, maybe I misspoke. Maybe I misunderstood, because I thought they kind of would try and bully people, or maybe that's somebody else I'm thinking of. All right.
I think that was more of a peer pressure, like a worldwide pressure of, hey, this is what the WHO recommends.
Yep.
We need to be doing it because they're recommending it.
They recommend it. So
in full disclosure, so much of the pandemic was was hindsight that we see now. And so much of the pandemic was, well, there was no precedent. There was no precedent. I mean, there are, but like how to handle it in a developed civilization, like a developed culture.
The only precedent was the Spanish flu of 1918. That was 100 years ago. So
lot different times, you know, that,
right.
that now with the life expectancies are different now. The technology's different now. The communication's different now.
We have aircraft. You can fly from one place.
You're right. You can intertwine with any culture, with any people, with any genetic pool that you want at any time in technicality. So,
right.
You know, when I look at it, like it's really hard to be like, your policy sucked and you knew it. And it's like, well, definitely some of that exists, but probably a lot of it is that people are like, hey, let's make a decision, but they don't really know what to do, because it doesn't matter if you get all the foremost experts in the room or not. If they've never dealt with an issue before, there's going to be corrections. They're experts because they made corrections. They're experts because they learned. They're experts because they failed forward, because they made corrective adjustments to mistakes they may have made. That's what makes you an expert, besides education, experience. That's what experience is.
Absolutely. And I also think the problem with the pandemic,
that put a huge bad taste in the mouth of, you know, me included. You know, I look at it, I'm like, you know, geez, they were wrong on so much crap. The stuff I didn't like was like mandating things or statistics being skewed. You know, the CDC. I would look at the statistics of the flu versus COVID, and typically the flu season, we'd be right here. And then all of a sudden I saw that dive and then COVID. And I'm like, what are you just lumping all the numbers? Like, I just saw so many weird things that just really put a bad taste or put mistrust or made me question or think of things a certain way that I would never have thought of in the past. Like a flu shot. I would never go a year without a flu shot. I haven't gotten one since COVID, because I'm like, I got COVID 4 times. Like, I've gotten COVID. I live in like the COVID cesspool of America. I mean, if I've gotten it that many times, I mean, I'm going to be as immune as I possibly can be. Now I don't know what's real or what's not about this other thing. And it just scares me. Right. And a lot of it could be very illegit, but we found out there's some things that are legit. Right. So who's to say? And it really, it's a shame, because it puts a huge skew on what people can trust when you're supposed to be able to trust. Like you, I'm supposed to be able to trust you as the doctor, right? Now you're going to make mistakes and your judgment isn't perfect, but it's going to be better than anyone can make outside of what my own body is telling me.
That's why it's called, doctors are called practice.
Correct. Those two. Jeez, you are savage today. I love it. You're a
but what I was going to say.
I don't know why I come here. I don't know.
Oh, come on. We love you. No. And like what I was going to say about the pandemic was, you know, I would have, you couldn't have paid me enough to be in any of Trump or anybody's position, because that was a curveball that came out of left field that nobody knew what to do, you know, and people were dying. Well, we all have our beliefs on it. This isn't the show to get into that one, but I think that, you know, situations like that where things occur, you got to fly by the seat of your pants and go with what your gut's telling you. And you ask all the medical officials and all the medical opinions you can get and make sure you go with the right one. And if you screw up, everybody's going to crucify you. But you were the one in charge, so you had to do it. And it became like, it was a big finger pointing game and do this, do that. And I was, you know, we lived in Florida. I grew up in Jersey. I'm from New Jersey. And you know, the lockdown situation that they had up north versus what we had was just like, and people, you know,
I started in Michigan, my friend, remember?
That's right. Yes. And that's why people, like, I have friends from up north are like, oh my gosh, dude, how are you going outside? Aren't you scared? What? Who's telling you this?
I had to get a haircut. I had to move to Florida to get a haircut. And I'm only half joking.
My son went to Michigan to stay with some friends and family up there for a while. Just before COVID happened, he was working. COVID hit, everything shut down. He lost his job. He drove back. He was scared he couldn't get back into Florida because they were telling him, "Oh, the borderline's closed. They're not going to let you in." And he was calling me, and he's like, "Dad, will you come get me if they won't let me?" I said, "They're going to let you in, bro. They're not. There's no National Guard on the highway with guns aimed at your head. Now they had to go through a checkpoint and show his driver's license and prove he was from Florida, but it is what it is. I just thought, I thank God. I would have not wanted to be. Now, were you in the prison system at that point in time? You were still in the ER.
I was in the midst of it. I was in the middle.
Yeah, I couldn't. I wouldn't want to have been in your shoes, because you guys forget about what the big wigs are doing upstairs or even higher ups at the Capitol. Forget about all that nonsense. You guys were in the midst of the battle, and you didn't. 7 ways from Sunday, things were coming at you. I went. So I had COVID. All right, Derek, you beat me. I had it 3 times. 2 confirmed. I don't know. The 3rd one, I'm pretty sure I had it, but whatever. I didn't even get checked. And after the 3rd one I had, which was just a head cold. It was really weird. I had a bad headache and a cough, and it was gone in a week. About 3-4 weeks later, I was like feeling very weird, like chest pains and heart palpitations, and I was watching my blood pressure, and it was a little weird. It was a little off, but I was watching my heart rate, because I learned a lot when I was in the hospital. I'm watching my heart rate. My heart rate never went over 80 beats. So I'm like, okay, I'm not having a heart attack, because my heart's beating regularly, but it feels like there's an elephant sitting on my chest. So I get to the hospital. My wife, after 2 days of it, my wife's like, you know what? We're going to the hospital. There's something wrong. So we get to the hospital. The doctors checking me out. They got me hooked up, EKG, everything going on. They checking for everything, and they give me an injection of a little relaxing juice, and within minutes I was back to normal. And the ER doctor came in and he says, I just want to tell you, we have seen more and more issues like you just had from COVID. I said, well, what did I have? He goes, a super anxiety attack. He goes, COVID hit you neurologically. And he says, some reason it's triggering anxiety attacks in people, and it seems like you're having a heart attack. I thought for sure it was the big one, but like I said, I have learned to watch my heartbeat, and if I'm sitting between 57 and 70, I'm fine. That's my normal rate, right? If I was up over 120 or something, I'm like, okay, something's wrong.
Something's wrong, exactly. Yeah.
I'm not at the gym. I'm not working out. There's something wrong. But my blood pressure was weird, and that's what was throwing me off. And the doctor explained, he's like, psychologically, you were getting yourself worked up, which is going to raise your blood pressure. And so you thought you were having a heart attack, which he's like, we have seen this more and more. It is unexplainable, a side effect from that virus COVID that nobody knows what the heck's going on. So it was attacking people neurologically.
Yeah, it's a bizarre virus. It takes people that you'd never, bizarre stuff, blood clots, of course, which led to strokes, myocarditis, just bizarre things that came about that seem to have nothing to do with the virus, but yet it's able to trigger that thing or the other.
That's what he was explaining. They said they're seeing things that are unexplainable that no flu you shouldn't have from the flu, but this thing is bringing little friends with it.
It's just something bizarre. I tell you, it was, of all my experiences in 30 years in medicine, nothing was like what happened that year, 2020 going into 2021.
Right.
So the impact on my career, what I saw in society as pertains to healthcare, and how it was a curious situation where you feel you're being cheered as a hero one day. All kinds of things. They're bringing food to the ER, restaurants, especially during the first wave in spring of 2020, and again in the summer when the riots were taking place and the Black Lives Matter things are going on. The country was turning upside down, and we had a second wave of COVID. That was far worse in terms of the number of people and how it shut down our hospital, a massive hospital like Jackson. But yet, and by then, the idea that you're a hero was beginning to twist. We're now beginning to see being seen as, in some quarters, as the villains, pushing this government agenda. And there was no vaccine then. I would just ask people, just please, we didn't know anything else, at least wear a mask. The N95 is what kept me alive. It kept me well working in that ER department.
Right.
Up to the point where a waiting room that's made for at most 40 or 45 people had 114 people in it. People in a waiting room, coughing and sneezing. The ICU was full. We had ICU patients in the ER. They converted an entire wing of the ER to the COVID. We call it Zona Corona. And who did they put in there? Me and this other guy. it was the craziest time of my life. The people you saw who would fall ill and die, and if you ventilate them to save them, then the ventilation we realized was actually killing them. We threw everything but the kitchen sink at everybody, especially during the second wave. And we had nothing else, no vaccines, no it was a really bizarre time. And then you step out of that, get home and turn on like the shower every time I came in. It just changed your life because I didn't know what I was carrying and I didn't want to bring it to my family. And then you turn on the TV and you see people talking heads, talking absolute nonsense. It's not real, it's this, it's that, it's just the flu. And I just saw somebody die of it. And I saw what it was doing to the hospital I worked in, a health system that just did not have the capacity to handle it. And even after the second wave had gone down, the ER numbers of normal people coming in just didn't go up to what it was before because everybody was afraid of going to hospital. So think of the number of people who had chest pain or they're having a heart attack, but they're scared to go to the hospital. I don't want to get that COVID thing. I don't want to get that Rona. And they stay at home and they die instead.
Yeah, sure. And the thing that I realized, I was working in an industry that was considered a needed industry, so we weren't restricted or anything like that. But I saw people, grown men and women, terrified. They wouldn't come out of their house.
Yeah.
I have a friend whose parents, I think for 20 and 21, never left their house.
Crazy.
And I mean, look, it was a thing. It happened. I mean, there's no denying it. I got it. The first wave was the roughest. That one knocked me down. I got hit pretty hard. And I didn't get it till the end of 2020. I got it in December of 2020. And then so Christmas of 2020 and 2021, I got COVID both times. I said, okay, that's my Christmas gift. But the thing that kept me healthy, and my doctor actually told me two things. I was out walking outside every day in the park. My wife and I would go for walks because there was times I couldn't work because people weren't accepting us to come over. Or if we had to come over, we had masks, gloves, booties, hats. I mean, I'm like, I don't have a biohazard uniform. I'm sorry, but so I mean, I was not offended by people's fear. I was shocked by it though, to see someone who one of my coworkers was like, he would tell me every day, he's like, dude, I'm terrified. I go, of what? He goes, this virus. I said, okay, go outside, breathe fresh air. So that kept me. And then of course I wear a CPAP and a lot of people say that the doctor told me, he's like, that kept your lungs going. So even if you did have it, you were having help. So you didn't have to worry about it.
Dude, I had an employee who nearly demanded that we be misted with alcohol when we entered the premises as he smoked 2 packs of cigarettes a day. And I literally had to say, don't you think you're already a little far gone for that?
But they were the most vulnerable, people who had lung damage and asthma, heavy smokers.
Sure, but
my point is, who was the previous mayor of New York City? Bill.
I'll tell you, not Bloomberg. Was it Bloomberg?
No, yeah, Bloomberg. No, Cuomo. Was it Cuomo?
No,
he was the governor of New York.
You're talking about
de Blasio.
De Blasio.
Okay, so again, Dr. Greg, here's other things that really jaded me. I have the mayor of New York City eating a greasy hamburger, a artery clogging hamburger, and saying that you could get a free one with a proof of vaccine. I had a governor in Michigan who gave a lottery prize with with federal money, which some of it came from this great state of Florida, for proof of vaccine. That is wrong. In my point, I never saw so much commercialization of healthcare and record profits from Pfizer and all these things in one time. And I just said, I don't know if I trust anybody. Okay. Because this, I don't know what this is, but I know there's money involved. And I know when there's money involved, I know the point is to grab money.
Sure.
And guess what? Let's fast forward 4 years later. Wow, a lot of people grabbed a lot of the wrong money. And look where we are. We are not good in a lot of ways right now. And
imagine if they had dumped all that money into the true research.
It was just a very disturbing time.
Truth be told, guys, truth be told, they did a fantastic job. The Trump administration referred to it as Operation Warp Speed, and I think it was something that was it was a fantastic job to put together this vaccine in so short a period of time. Now, having said that, they've been doing work on RNA vaccines for about 4 years, so it's not like they did it in 4 months. But the idea that they could actually put it together for a current pandemic, they put out all the stops, it costs billions. And they use simple tricks, like, for example, instead of waiting for a year when you put the FDA, look for FDA approval, it takes over a year because you're at the back of the queue. There's so many other drugs ahead of you. They just bumped, if it's COVID, vaccine to the head of the queue. And that just saves you like a year of waiting. Even when they found they got a vaccine they would think would work, it got to phase 1, phase 2, phase 3 trials or whatnot. The idea is you have to wait until you get all that before you start the manufacturing process, because it's expensive to manufacture millions of vials of vaccine. So they say, well, even if you haven't got to the full approval, start the manufacturing process. If you don't get the approval, Uncle Sam will pay for will cover your losses. It costs billions, but it was all just to get the vaccine out, one that will work as fast as possible.
Right.
And it did work. And believe me, apart from measles, there are very few other medications, vaccines that have been that effective the way the initial Pfizer-BioNTech vaccine was. So I believe that was a success. But of course, this is big business, man. They got to make some money, right?
Oh, yeah.
Yeah, baby.
All they could. Your booster, your second booster, your third booster. You know, they gotta let this thing cook. But I still hail them for what the technology was able to put together over that period of time. And those who know will tell you. Unfortunately, there's a big messaging problem. Look at what Derek is saying. At the end of the day, so many people didn't know who to trust anymore. One, because of money involved. Two, because there were so many conflicting stories that had taken place during the year. Even I was hesitant to take the RNA vaccine because I had to read about it and research it and whatnot. And then my young residents, they were, oh, well, I'll take it. I said, I'll pass for the first couple of weeks. After about 2 years, what am I waiting for? I've read all the research. Stop being stupid, Greg. I took the shot and I gave it to my family as well.
So a day in the walk me through a day in the life in the ER during this pandemic. Like, things were getting thrown at you. How do you react to that? How does your mind work? Like, listen, if I'm in a doctor's office, I'm visiting because I have strep throat. They have the process, the steps to go through. Yeah. You're in the ER, people are coming in and you're going, what the frick? What's going on with this guy?
You take your temperature first before they roll them in.
Yeah,
that's right.
Well, everybody gets temperature in triage anyway. That's normal.
Yes.
But at the height of the pandemic, at the height of the first wave, everything had to be restructured around the fact that we are now in a pandemic. So it's masks, gloves, all that kind of nonsense.
Sure.
And I kept getting the feeling that this sounds like I'm living through history. This is never going to happen again. I'll be telling my children about this, like 9/11 or something like that. As it's going on, you know that this is so significant and everything is so different. And so that's how it changed from triage to having to separate a section of the ER specifically for COVID cases, anybody with a cough or a cold or a suspected fever coming here. We had the testing, which eventually sped up to the point where we could get the results in a couple of hours. When it first came, we'd take the swabs, send them to the state, and the state would give us the result the following day. And then we'd contact the person and say, you're positive or not. But as the months wore on, we got better and better at it. There's more resources being thrown in. And so everyone is getting swabbed, everybody is getting tested, even though there's no vaccine. And it just changed the way we operate. And then when the peak of the wave came, where the ICUs were full with ventilated patients and we just couldn't handle anything else, we rolled them out into the hallways and treated them in the hallways instead. And that was madness. It lasted about...
You were at Jackson Memorial when this was happening?
Yes.
Wow.
The biggest hospital in the United States.
Is it second or number? Is it bigger than Pittsburgh?
It's number 3 actually, because what's it? It's oh gosh. The Methodist or whatever in New York. There's 2 that are bigger, but they're on multiple sites.
The Presbyterian?
Presby. Yeah. But they're on
my dad actually had open heart surgery there, so
yeah.
I know the hospital.
And what's the other one? The 2 that are bigger. But on a single site it's Jackson Memorial in Miami, 1,500 beds officially. Of course, they never have up to 1,500 beds available, but we can fill the places with 1,500 beds. It's the biggest hospital. And the ER is always busy. It's massive. And so you can imagine what it was like during COVID. It was just...
Derek, that'd be like, what, 3 resorts at Disney.
3 resorts at Disney.
Derek's a very big Disney guy. He knows how big the resorts are. 1,500 beds. That's 3 500-room hotels.
Doesn't mean I know how many beds are in a hotel.
Come on now.
I just
Come on now.
I think Jackson's huge.
Yeah.
It is, but it crippled us as it did all the other hospitals around Miami, because you get the stats. We knew what was going on. I knew Memorial was shut down. I knew Baptist Kendall was shut down, just like us, locked up, couldn't take any more patients. What could we do? We just come in, put them in the hallway.
What was the what do you think was the average age patient you were seeing? Was it more elderly, or was it didn't matter?
It didn't matter. It didn't matter.
Okay. So there was no demographic age group that were coming in.
But the mortality was higher among the older ones.
Of course, yeah.
And even in the first wave in April, May, we quickly realized this thing doesn't seem to affect children.
Right.
And then you found out the physiology behind it. They don't have, the receptors and stuff in the lung. There's complex physiology, but very early we realized it doesn't seem to be affecting children.
Wow.
People who are getting most affected or most vulnerable, more likely to die, were the elderly. And then in the elderly, diabetics, people who are overweight, and even people who have heart disease. And we lost a couple of members of staff. That was heartbreaking in the first wave. I remember coming in and we had a testing station just outside the ED during the first wave, and the line outside was all the way out to the parking lot as I came into the shift. What was going on? And there were nurses on the line who were crying. And they said one of the ICU nurses had died, and she was about to retire that year.
Oh, no.
And after she died, everybody was going out to get tested. Everybody's go out and get tested. And that's how they were lined up. And that's why some of them were still in tears. One of the radiographers, a radiology tech who works in the ER, he got it. He died. There was one of our ER receptionists. When she got it, next thing I heard, she was in the ICU. And then I heard through the grapevine, she's been intubated, and everybody was scared. What's going to happen? Is she going to make it? She made it. She was fortunate. But it's when it hits you when it's somebody who it's close to you. So you're seeing it happen in real time. And I described it when it hit New York first and LA, and then we saw the numbers going up in Miami. It was like a slow train wreck. You could see it happening. I'm just praying. I hope it doesn't. What happens in New York doesn't happen here. And it began to pile on and pile on and pile on, and then there we were.
Yeah, I lost a good buddy of mine. He was a deputy in the jail in Orange County, and he had the vaccine, and the complications. I don't know what happened, but basically his heart couldn't handle it. Whether it was from the vaccine or whether it was from the COVID or cold or complicated, whatever it was, but his heart, something had weakened his heart, and he couldn't take it. And he's my age, and so he's a young guy.
Terrible.
I'm with Derek. I was waiting for Derek to make a comment.
But what?
I said he was a young guy like my age.
Well, you're old as I can't say the word.
Methuselah?
No, he was going to say something else. I'm sure something very.
He was. We're gonna go from PG-13 real quick to R, but that's all right.
No, I'm gonna keep it there. I'm gonna keep it here.
Yeah, it's okay.
Keep it at a good level.
We try and keep it PG-13.
Yeah,
we mess up every now and again. So that I mean, that's just sad stories, but phenomenal. I mean, interesting. It's intriguing to hear stuff like that, because you're like,
well,
we lived through it. You're right. It was like 9/11. Or
you talked about the messaging, and here was the tough thing, because you've said those stories. We've lost people who've had COVID, who've had complications, who are elderly, who are overweight, who might have had a hereditary condition that we don't even
know about.
We don't even know how to connect it, but it could very well be, right? It's got to be, right? Because there's something, right? There were still people my age, marathon runners, dropping dead from it,
yes.
But my point is the messaging behind Stop the World. Stop the World was a great message, in my opinion, the first 2 months. What the heck is going on?
Yeah.
After that, the Stop the World message, especially when you're in essential work, and I had to go to work every day, right? Because we were in auto manufacturing. It's just an essential thing, or we have military manufacturing. So at my age at the time, which was 35, and my health, which I was 35 pounds lighter and just an avid weightlifter, just no bad food, no smoking, no alcohol, nothing whatsoever. When me, you know, being the statistical person, I'm like, okay, what are my chances of dying from COVID? And then what are my chances of not dying, but just getting in a car accident on the way to work? Guess which one was greater for me? Which was greater was actually the latter one. And I said, now with me in my line of work and what I have to do, if I have that messaging of I'm killing people when I go outside, I might as well never go to work, because anytime I get in my car, I'm going to die.
I think
and my point was the messaging that people took from that initial wave, which was I very much recognize how serious that was, the unknown. Plus, that was that the Delta, the first one, whatever they called it?
No, it didn't have a name. It was just initially it was just COVID.
That first COVID wave and Delta were super deadly. The COVIDs I got were all Omicron. They were nothing compared to that. They might have been months of fatigue or losing my taste, but they weren't these life-altering things. They were just a year or a year and a half of annoyance and always being tired and not knowing why, and just ridiculousness, right? But those first waves, I get how serious that was, but when the messaging carried for so long, especially up north, and maybe you didn't experience this as much down here, but up there for so long is like, oh, you're killing people by going out and this and that, and people were wearing masks running outside, and they wouldn't pass you on the sidewalk. They'd go, and it's like at some point, it's kind of like, okay, guys, listen.
Calm down. It's not that bad. It's not that bad. You can run outside. I've done mask outside. It's not
I used to do physique competitions. Okay, I'm a health nut, a nutrition nut. I've been for the majority of my life for a long time. Why can't things be rational? For example, why did it take COVID to make buffets require that you sanitize your hands beforehand? That should just do that. That should be normal, right? Why did it take COVID to say, hey, when we shake a hand, we should wash your hands, you know? Why did it take COVID to say, when you get home, wash your hands, blow your nose, alcohol your phone off, just kind of make sure. But you know what it's funny, but the simple stuff is things that I do to this day that I'm much more comfortable and find more effective than wearing a mask for me at this point, or being outside and avoiding people. I get home in the car, I blow the crap out of my nose if I went out. I don't want anything in there going up, right? I want everything coming out. I don't want that lingering, right? The hands are washed like probably 30 times a day, just nonstop, which is a fantastic practice.
But
right?
it dries the skin on your hands, though.
You're a little OCD, aren't you, buddy?
But why didn't we?
Sounds like it, right? It sounds
why didn't we take common sense practices and really drive them home? Why didn't? Because it goes back to profit. We focused on, eventually the messaging focused on a profit somewhere along the line, which gave people a bad taste. When we could have said, "Listen, man, wash your hands, blow your nose."
But they started that way. Remember, when COVID first started, when everybody was rushing out to go and buy toilet roll and it cleared all the shelves. Remember that?
Oh my gosh, please don't refresh that memory.
But at least at that time, there was a bit of common sense information going out. Wash your hands, stand 6 feet away, and all that kind of stuff. While we figure out it's a viral infection spread by droplets. At least we know that. Basic things. But things got out of hand as things began to unwind and people began to push back against the inconvenience. As they pushed back, there were those who said, no, we can't tolerate this. They are making everybody sick. They're killing everybody. And then the vitriol was flying back and forth. And who gets the fallout? Us in the ER. Because if we all work together, we could have saved more lives. I think it's significant that more people died in the conservative deep south than they did in the crazy north, where everybody's getting locked up. At least they live longer.
Would you say there's science behind certain vitamin deficiencies contributing to the seriousness of the COVID infection when you were to get it? Let's say if you were deficient in vitamin C or D versus someone who was not, that's a negative thing, right?
Yeah, but I think those are smaller issues than, say, somebody's got, type 2 diabetes and is being poorly treated.
For sure.
That's more of that. So with every viral infection, there's always what do you do to boost your immunity. Mm-hmm. And generally speaking, if you're more I'm healthy. You take your vitamins. You should be able to get vitamins from what you eat, and
Yes,
you look after yourself.
but in America, that's getting difficult. So
you tell me about it. Nobody should need supplements.
exactly.
If you eat properly, you should. Now, but let's assume you do take supplements, you do all that. Those things will help your immunity and will protect you to some extent from any sort of disease, whether it's COVID or any other infection. So I'll never push back against that. I think it's a good thing to eat healthy and stay healthy and improve your body's immunity, the natural immunity that you've got.
But the messaging would never push that because there's no profit in vitamin C or D.
I mean, it's dirt cheap, isn't it? When you could spend billions on a vaccine instead. Of course, the vaccine was far more effective than any of them. But as I always say, it's like I've got to depend on Big Pharma to give me the medications I need to use to treat people as a doctor. But do I like Big Pharma? No, I don't, because they're so profit driven. I would like them to help me to keep people healthy, rather than focus on here's the latest drug that can cure people who are sick. What can we do to prevent people from getting sick in the first place? Exactly. We don't have a healthcare industry. We have a sickness industry, don't we? And it is
and it's funny.
Exactly.
I heard you mention.
Where is the preventative health?
Mm-hmm.
I heard you mention you go to church.
I do actually.
If you understand the word, our bodies were built to heal themselves if we took care of our bodies properly. Unfortunately, there's so much junk in our food. And I was watching it's not a documentary, but it was like a mini doc, okay, on food in America versus Europe. There's stuff in America. There's stuff in America that is illegal in Europe.
Oh yeah. Do we still wash our chickens with chlorine with bleach or something? I mean, that's one reason why we couldn't export chicken from America to Europe, because they said we wash our chickens in bleach water.
So I told Zach this, but I've traveled to Europe a few times for long periods, and this past year I was in Paris and different parts of Germany for about a month in August, and it's always been true whenever I go to Europe, or really honestly most places around the world, I don't work out because I'm like, hey, this is my time to rest. I don't worry about what I eat. We do walk a lot. We probably walk 6 to 10 miles a day. We walk cities.
Yep.
But I'll tell you what, we don't. I eat bread, I have a beer, and we lose weight.
Funny, isn't it?
Well, it's disturbing, and it's pleasant when you're there, and it makes you upset when you come home and you take a bite of a dinner roll and your stomach grows 3 inches. And you're thinking, I'm being dead serious. There is so much humor and jest and truth, but the quality of food here is, for lack of better terminology, it just feels like we're getting poisoned. Like you can't get any lettuce that has any nutrients left in the soil it's grown into, even get any magnesium and iron out of it anymore. And why do you think consequently everyone's deficient in magnesium? Is because they're not eating salads? Is it because the food doesn't have it in it anymore? And now they need supplements, and now they need drugs. It's bull, right? Where's the good food? Where's the good food?
Gastroenterologist who's just exactly what you're describing. His job. He's a gastroenterologist. He does endoscopies and colonoscopies. He said the number of people, the age at which he's seen people with polyps and precancerous lesions in their colons, right?
Going down.
An old man's disease, 60s, when you get people at 40, then 30s, late 20s, stuff. I mean, he's been in practice for 20 years as a gastroenterologist. So this is real life to him. And I even can say in my practice, diverticular disease, because you get diverticulitis, you get a flare up, you come to the ER. When I was a resident in the UK 25 years ago, it was still being taught as an older person's disease, middle-aged to 50s and 60s, not even middle-aged, 60s. Mm-hmm. Now, you get people with diverticulitis who are in their 30s. And I've gotten so used to it, it doesn't even shock me anymore.
Statistically, that cancer has been the one that has decreased in average age, the quickest, correct?
Yep.
I mean, we're talking like people now, what used to be 60 years old is like 43. I mean, we had one of our insurance leaders just a few years back, 43, die from colon cancer, and he was able to get really expensive treatment because he made good money to extend his life for a couple of years. But it's like this guy died from colon cancer at 43.
Think about what those people were eating when they were in grade school and going into middle school. That was the 80s. And McDonald's and the rest, don't name any names, but the fast food industry really exploded from the 60s into the 70s. By the 80s, it was standard on every corner. You've got fast food joints we have now. And then think about what it was like before the regulations stepped. Now everybody complains about what fast food is. Nobody was complaining about it then. It was just normal. Your milkshake, your fries and everything. And all the kids would have that for school lunch. And when you come back from school, your mum buys it for you. It was just, that's what they grew up with from children through teenage years. And now by their 40s, you can see in their gut what you ate growing up. I can see so many lesions in your gut. And that's what the gastroenterologist was telling me. It's changing now. I thank God there's at least a perception that what we're doing, what we're eating is killing us. So we need to make some changes. But it's a slow change. It's a slow change.
Well, you know, it's really funny. The other day, I try and eat pretty healthy. I'm a bigger guy, but I've lost a ton of weight, and that was the gabapentin. I gained a lot of weight on gabapentin. That was horrible. That's a horrible.
Now you can just get some Mounjaro and reverse it all, so it's fine.
I am on Mounjaro.
Oh, are you serious? Can I get some?
No.
I need to lose 30 pounds, but my BMI isn't high enough, Zach. I'll hit you up later. Don't tell Greg.
I got a guy hook you up.
Cool.
No, but I try and eat as healthy as can be, and you know, we also take our fair share of supplements, and I believe in supplements. I actually have gotten on these all natural animal organ supplements, which are really beef liver, stuff like that, which amazing. The vitamin B and A and D that's in there is it's just awesome. That being said, I happened to walk by and my daughter had a thing of Oreos. I haven't had an Oreo cookie. I don't even know how long. And I bit it and I had to spit it out and throw it away because all I tasted was chemicals. It was not the Oreo I grew up with.
Yep.
It was disgusting. It was terrible. And I can't tell you the last time. Now, you might say Chipotle's fast food, but it's a little better. I don't know. Anyway, who knows? But I haven't had true fast food in probably. My wife and I probably haven't had in like 7 or 8 years.
Wow.
Yeah, I can't tell you. And it was funny again. My granddaughter, my son buys her junk all the time. She had chicken nuggets and a little cheeseburger and fries. And I walked by and I grabbed a fry and I was just like, what was that I just put in my mouth? That was not the fries I used to love and adore. So yes, I hear you. Things are just going so downhill with the food. And there was a time that I got addicted to documentaries on Netflix, and they had the Food Inc. and all these other ones, and I was gonna fight the man. We're gonna eat farm to table. I don't even know if I could find a farm around here to do farm to table.
Where are you gonna find it?
Yeah, and how do you know if it really is true? I always joke around with my wife. I said you wanna buy organic. How do you know there's some guy in the back, Wally the stock boys stick organic? Not organic. Organic?
Not organic.
Yeah, I mean, how do you know? I mean,
well, that and the fact that the term organic doesn't even really mean what you think it means anymore.
Right.
You can go to public. The problem isn't that there's fast food, although that is a problem. The problem is if you want to eat healthy and you go to your supermarket, you go to Publix and you get a bag of lettuce, I'm only talking like 15 years ago. You can taste it. Like, it tastes bad.
Yeah.
It tastes horrible. There's no nutrients in it. It's garbage. It just, I can't even describe. It's difficult. It's not difficult to educate yourself. It used to be difficult to educate yourself. Then it was difficult to get the resolve to do it. And now it's difficult to
even find what you're looking for. Now you've got the result, but it's not there anymore.
If you go to a Chinese restaurant in Europe, you're going to feel better than if you eat a salad from Publix in the United States. That is, I am not exaggerating.
I think you
That's
are.
crazy.
I'm not exaggerating. It's true. It's true. You can,
You know, and Derek, you brought up when you were in Europe, one of the things you were like, why are the portions so small?
So
But then you
small,
realized,
yeah.
but you realized it filled you up because it was good food. You know, and I grew up, luckily, I grew up with, my parents were very much, they were not like health food nuts, but they did not believe in fast food. My mom cooked a meal for us every night. My dad and his twin brother had a big garden at my aunt's and my grandmother's house. So we had fresh vegetables all the time. We had a salad at every meal. Tomatoes were fresh. Jersey tomatoes are the best. Jersey corn is the best. And, you know, we always ate healthy and fresh. And I hated it because when I became a teenager and had a driver's license or a friend who was driving, first place we went to go hang out was the pizza shop or McDonald's or, you know, 7-Eleven. Let's go get some, you know, sodas. And anyway, and now I look back on it and go, Dad gum, I want to put a garden in my backyard so bad. I want to get chickens. My dogs will eat them, so I can't do that. You know, I want fresh
and then you
eggs.
can actually get eggs.
Then you can get eggs, right? Then we get eggs.
Every customer I visit that has chickens always ends up giving me a dozen eggs before I leave. And fresh eggs taste so different than store eggs. And I don't know if you ever realize this, and I don't know if it's from the process of how they do the eggs or whatever, but if you get a fresh egg straight from a chicken coop, it's almost impossible to break the shell. Versus an egg you get at the store, you just tap on the counter. It's, you know, it's broken.
The shells are so thin. Now you mentioned that, you're right. Shells are so thin.
Yeah, but on a fresh egg, they're solid as a rock, and you got to like really crack that thing to get it open. And the yolk is just bright yellow, and it's just and it tastes so good. But I'm digressing now. Now I'm hungry. I'm gonna go scramble some eggs. No, I'm not.
I haven't even bought eggs in months, man.
It's after 6 p.m.
I used to eat dozens of eggs a day when I wanted to die. Like, it's the most awesome, complete protein, hormonal supported, just beautiful food. And it's killing me. I haven't bought them in 2 months, man. Like,
you know who eats eggs in my house?
Oh,
who's that?
My dogs. They get a fresh egg every day, every time they eat.
You give eggs to your dogs?
that's
they get a raw egg. It's really good for their skin and their coats. They love it.
Rotten.
Yes, they are. Oh, I also cook a big crock pot of chicken for them. They eat better than most people do.
Josh.
Yeah, they're my babies. You know, you got to take care of them.
But
you know, we're trying, and I think America is becoming educated to the garbage. Now,
that's the point. That's what I was saying earlier on. I think it's changing. At least people are more aware.
I see a tide. I see a tide changing, but the problem is
we'll get there. Yeah.
And I know this is not a what's the word I'm looking for? A good excuse, but you hear it from people, whether they're unhealthy or they're just obese. They're like, I try to eat healthy. It's just too expensive. Well, don't go to Fresh Mart. Go to in here by Derek, actually, is a town called Winter Garden, and they have a farmer's market every Saturday, and it's all farm fresh food. Go there and buy it. Go seek out your local farm. You know, I have a friend who was lactose intolerant, but he can drink raw milk. It doesn't bother his stomach at all. I don't like regular milk because it gives me heartburn, which is really strange because milk is a base, but for some reason milk gives me heartburn. So I drink almond milk, and now I'm finding out that almond milk isn't probably good for me. So my wife's like, well, maybe we should try raw milk. You know, I don't know. I don't.
Well, I don't see much. I don't know. People make swear by raw milk because it has one thing or the other, but there's not much difference between raw milk and pasteurized milk because they only raise the temperature to 67 Fahrenheit. It's about what 100 or so. So they
bring it to a boil, right, to get the impurities out, I guess.
No, not to a boil. Not to a boil. It doesn't get up to anything like a boil. It's about 100 and something Fahrenheit that they get it to, and it stays at that temperature for a few minutes. Then let it cool down. They put it in the fridge, and it was invented in order to kill off, I think it was tuberculosis, one of those basic bacteria at the time. They found it killed off quite a few bacteria.
Well, if you want to kill bacteria, you have to go over 120, I think.
No.
Centigrade, yes, but you don't. That's the thing. It's not sterilized milk. just warming it up to that sort of not very hot temperature is enough to damage some sort of bacteria. Certainly.
Okay. So they're not trying to sterilize it; they're just damaging the bacteria.
If you drink sterilized milk, which I have drunk as a kid, and I thought this is horrible. It's in a sealed bottle, and my mum bought it a couple of times in England. Like, oh, what's this? It's sterilized milk. I hated it. So I thought the regular milk was more natural.
Okay, so sterilized milk would be kind of like distilled water.
I don't know what they did. They must have really boiled it or something, I suppose.
Yeah,
you'd have to boil it. You'd have to get it to 212 Fahrenheit.
Yeah, but that would coagulate all the protein. But I don't know how they did it. But yeah,
I like I said, I don't understand. My friend also does he makes his own kefir and stuff like that, which I've tried. It's just too much for me. But but there's so many things we're learning every day. Like I follow several different doctors, and I'd love to get them all on the show, because they would just sit and argue the whole time, because one guy's a carnivore and one guy's almost a vegan, and one's better than the other, and I'm just like, I don't even know which way to go. How about I get a little of both? I'll have a salad with my steak, okay?
Yeah, that's
make everybody happy.
I'm an omnivore. Our teeth and our digestive tract were made for it. We're made to eat both vegetables and meat. So
yes.
High fiber, lots of vegetables, lots of fruits, and good meat.
I do a good daily intake of fiber, and I do take a lot of protein in. So
yes, you do.
I try and do my best, but it's just do you think, and I'm not by any means getting political, but do you think this new Make America Healthy Again kick with RFK is going to impact people? Or is it going to be kind of a flash in the pan that this is the greatest, latest thing that's going away?
I hate to sound cynical, and maybe it's my age. I think it's going to be a flash in the pan. It takes a lot more than that. Think about smoking. I mean, the industry, they fought against the idea that smoking was bad for you. It's good. It's normal. Even pregnant women were being given cigarettes in the 1960s.
My doctor used to smoke when I went and saw him.
It was normal. It was normal when I was a kid. It was normal in England. It was normal for him. But it took decades. Slowly, till there's a cultural change where if you're seen holding a cigarette, it's not cool anymore. It's unhealthy, and that's a long time. I remember Michelle Obama tried to do something back in her days, and to get school children to eat healthy food and whatnot. And the pushback from the conservatives, I mean, they hated her anyway. It's like, who are you to tell us what to feed our kids?
Right.
When the conservative side has come up with RFK and everything, he's a crackpot. You don't know what he's talking about. I don't know, shut him up and all whatnot. At the end of the day, it's going to take a bit more than just one famous person pushing it. But the more people who talk about it, I think the knowledge is increasing that we are poisoning ourselves, and the food industry is just trying to make a buck, and they don't really care. And the more people understand that, market forces will make more. I mean, it starts to think like Whole Foods, and how old is Whole Foods? I don't know. But somewhere along the line, someone's going to see an opportunity here and say, I am going to feed the health buffs with real organic food, not just sticky label on it. And
he's taking us to church.
No, but
the awareness is going to become so great that someone's going to find a way to capitalize it and improve it.
And that's how things begin to move forward.
Yes. So that's great. But let me throw maybe a little curveball.
Don't please. I preached so good.
Two things I'm going to throw at you. Where's my camera? Two things. Number one, do we remember 9/11?
Okay.
Do you remember how Americans were after 9/11?
United.
I walked through the Chicago airport after 9/11, and there was a World Cup game on, and the whole airport was chanting USA because we had just scored. Okay? It was the most amazing thing. Brought chills to my now we want to kill each other. We can't even decide who's male, who's female, who's using what bathroom, whatever. The number two thing, do you remember COVID? Everybody was terrified. Everybody was trying to be more healthy. Everybody was keeping their distance. Everybody was wearing a mask. So this, that, and the other thing. That went out the window too. So look, people who want to get better and want to get healthy have to make that mental decision and make it a mindset and do it. And there's too many lazy people that won't do it. They'll say they're going to do it, just like the worst place to be after New Year's Day is Planet Fitness, because it's so packed you can't even move in there, right? Yep. So I don't go to the gym in January. I go back in February.
That's
right. And because nobody, I went to the gym today. It was the first time I've gone. All right, so I messed up my shoulder and my knee, so I couldn't work out. My physical therapist just released me to go back. And it was the first time I've gone back in probably close to 5 months. And it was great. Nobody was there.
Nobody was there.
And I said, honey, if we had come here a month ago, this place we wouldn't have been able to get on a machine, you know. It was anyway. So
Yeah,
I think unless we make a complete 180 the entire country, food wise and health wise and thought wise, some are going to get it and some are just going to keep dying from obesity and all these other terrible things that happen from it. And look, I'm not one to point the finger because I was fat for a while and I used to joke and eat, drink, and be fat and jolly. It's not fun anymore. So as I tell everybody, they're like, well, what's with the lifestyle change? I said, so the first 50 years of my life, I did what I wanted to do. And I found out that was not the way to do it. So the second 50 years of my life are going to be the way he wants me to do it. And they're like, you're going to live to be 100? I hope so.
Why
Maybe
not?
120.
Why not?
What? Who says I can't? No, the average age, I don't care.
I think it's
Sorry?
generational, Zach, because you have, isn't it true, doctor, that statistically smoking and alcohol are decreasing in some of these younger generations?
Smoking and drinking, yeah. They vape instead.
Well, yeah, I know.
And I think vaping is worse. Vaping's worse.
But yes, but drinking and smoking has been, and there again, it's this cultural change that takes years or decades to kick in. It's no longer seen as cool. It's no longer seen as fashionable, and people pull away from it. And I believe with people like you guys out there on the podcasting sphere, spreading a message, the more people that talk about this, the more it becomes a thing, and the more change will eventually get there. But we don't expect it to happen overnight. But at the same time, don't give up. Don't think there's no point. Nobody's listening to me.
I think awareness can create opportunity for a market to capitalize where people improve, and I think people will capitalize on doing that and spread that word and have a true belief in that, which is what makes it spread. And I think the other half choosing not to, eventually, generationally, will get so sick of being sick and 500 pounds and not being able to walk when they go to Disney World. You know, they actually want to go somewhere instead of on a scooter. I think that eventually they'll see that, and people get sick of the lifestyle eventually. And we're talking maybe 60 years here to where they say, I don't care if it's uncomfortable to change. I can't go another day because I can't fit into my clothes, or I can't. I feel like crap, or I can't move. I can't play with my grandkids. I can't do anything. I can't live this way anymore. And by the way, these 27 people who I said, screw you for your beliefs over the last 20 years, now all of a sudden it's like, that's my belief too. I think it's generational.
Yeah. And I agree. And look, it took to the point now, you know, obviously a lot of my weight gain was from medicine I was on but even after I told myself I felt like I was trapped in my own body and I hated it, and it scared me. And, you know, it takes a lot to get me scared. So it's the fear fired me up to do something different. And maybe that'll be the change people need to do. They need to see that and feel that, and they'll move forward. Or unfortunately, like, you know, there's the other statistic, and they just stay where they're at and they're satisfied and they die. And, oh, it was so sad. She was only 45, you know, and there's nothing more frustrating. And I say this because I do know there's people out there who obviously are challenged, handicapped, or whatever, you know, and they need the electric mobility carts or they need a wheelchair or whatever. But there's nothing more frustrating to be at Walmart and seeing somebody younger than me in one of those because they weigh 400 pounds. And I'm like, when did you quit? Why did you give up? What the heck?
You're about to see a lot of that on Saturday, Zach. So get ready.
I know.
I'm being dead serious. Go to Disney.
I'm going to Disney.
It's not that there's more crowds. It's that there's so many scooters you can't fit the traffic. It's awful. If you go to Disneyland Paris or somewhere around the world, it's not that way. When you come here to the happiest, magical, whatever, most magical place on earth, it's also the fattest place on earth.
It's terrible. And let me tell you what, I've seen
more of
some
that.
of the
You're going to
food
see more of that on Saturday than you've ever seen in your entire life combined. Mark my words. Come back, observe, and report. And you're going to, if you want to go from feeling, you're not going to know how to feel.
Well, I will tell you
Yes.
one of the things that happened. Lorianne left. She says, I have no tolerance for ignorant people. That's one of my pet peeves. And we were at Wally World, I don't remember, or Publix, one of the two, and we were shopping, and it was post COVID. It was not, and I wasn't wearing a mask. My wife wasn't wearing a mask. We're healthy. We're fine. And this lady rolls up in a electric wheel scooter, and she looks at us and says, "Oh my gosh, put on a mask before you kill somebody." She's 400 pounds. I said, "Ma'am, I'd be more concerned with your heart condition or diabetes than me giving you COVID." And Lorianne's like, "What is wrong with you?" I said, "I got no time for some lady yelling at me. You're not my mother. Go away."
Oh God. Well, that's what COVID did. I want to think that what COVID did, it revealed so much about what our society is. The nastiness and the partisanship and the vitriol that was being thrown from one side. COVID just gave us something more to argue about.
So during COVID, I worked in the moving industry, which I was an essential because people had to move. And I was an estimator. I would go to your house and I would go through every single room, nook and cranny, marking everything down the truck was going to have to load up, how big of a truck, how many trucks, blah, 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 whatever. Do you know how many closets I would open and there would be like 80,000 rolls of toilet paper?
You saw the toilet paper. That's where it all went.
And I was like, I would say to people, a little overboard here? And they're like, "Oh, you never know." I go, "Oh, I do know."
What happened? What? And it wasn't only in America. It was in the UK. It was in Australia. What happened to people that first few months?
Funny story. We went on this just before COVID. I signed us up for this environmental friendly toilet paper. It was a delivery service. We'd get a case a month, which was plenty of rolls. It was just me and my wife and my daughter, and maybe my son was living here. I don't remember. And it was made out of bamboo fibers, and it was supposed to be super dissolvable for the septic tank. It was really good, blah, blah, blah. COVID hits. Everybody's going rampant with the toilet paper. And they send out an email and they said, "If you were a subscriber before this date, you will always get toilet paper. Do not worry." I never bought it once during COVID because I got it delivered to my house.
They were still delivering your bamboo paper even when all this craziness was going on.
And I had to stand outside with my gun waiting for it because someone was going to try and rob that case. But anyway, there's so much we can talk about. And Dr. Greg, we're going to have you back on. We've really, really enjoyed it. We've been on. This is a good show. We're going on 2.5 hours.
Great, honestly.
We appreciate it. Now, you're an author. Do you have something you'd like to promote?
Well, what was I doing during COVID? I wrote a book, and if you're more religiously minded, you may find this of interest. You would think that.
Wait. Are you the Nigerian prince that I get emails from?
Oh no, that's my brother.
Oh, well, tell him he owes me some money. Come on now.
Just kidding.
You know what? I had to throw it in there. Come on.
You had to, didn't you?
All right. So go on with your book, please.
You would think that I would have been more prepared on a day like this and should at this point be flashing the book and showing to everybody. Well, it's called how can I draw a blank on my own book? It's called Chasing a Shadow.
Chasing a Shadow.
Chasing a Shadow. And the subtitle is Why Christianity in America is a Shrinking Minority and What to Do About It.
Nice.
Now, the reason why I wrote the book was it had been 22 years since I became a Christian and then moved to America in the last few years and everything. And I had seen a disturbing picture of what I thought the church was doing, its involvement with conservative ideology, politics, and so many things that I thought were not biblical. And that's why I wrote the book. And I felt that Christians were chasing a shadow and leaving the substance behind, which is a rebuke I often used to get from my father, warning me and my brother in our younger years, acting the fool. And so I took that phrase from my late dad and said, yes, the church is chasing a shadow and leaving the substance behind. And it's an easy read, and it talks about a lot of sensitive topics as to do with what the church is doing, what the church should not be doing, and why we are where we are, going back into the history of the church and America to where we are now.
And where can our listeners find it?
You can find it on Amazon. You can find it on Apple Books. You can find it on Audible. You can find it on the Walmart. What's the Walmart app? Anywhere you can find a book. If you type in "Chasing the Shadow" by Gregory Adaka, and yeah, if you want to just listen to the Audible version, you can do that as well.
Awesome. Very, very good. There you go, folks. Check it out. We'd like to once again thank you for being on our show. It has been a great first show. We want to tell you we have an open door. We'd love to have you come back because your book could probably be a whole show we could talk about, because that's a subject we'd love to chat with, and we could probably talk more about the health in America, and maybe the next show we have them on, we can focus on just doing that. How to maybe we get your buddy the gastroenterologist on and have him discuss America, why they need to start eating healthy, because what their gut looks like.
Yep.
I think that would be great. But you know, we once again wanted to thank you for stopping in and visiting with us. We have enjoyed it immensely, and we're definitely going to be bringing Dr. Greg back on. And of course, we want to thank all our subscribers and all our listeners. This is our first show, so we're going to have lots of subscribers and listeners. They're going to come back to this show and go, "Wow, they were thanking us back on day one." But we do appreciate it, and Derek, my co-host, would appreciate your great interviewing styles as always, my brother.
Yeah, and we'll post the link to your book directly to your website, so people can find all those areas to get it too, if they want to go to Kindle or Apple or anywhere, so they can take a look.
We'll put a link up for you.
Thank you. It's all there. But thank you so much, guys. This has been a wonderful experience, and I would love to do it again.
Absolutely. Yes. Thank you very much.